Okay, we're at 12:30 and we have the man of the hour. So welcome everyone and thank you so much for joining us today as I call to order the September 2023 joint meeting of the Raise Family Caregiving Advisory Council and the Advisory Council to Support Grandparents Raising Grandchildren. I'm Allison Barkoff, and I have the privilege of leading the administration for community living. And I am so excited to introduce our first speaker, Health and Human Services Secretary and my boss, Javier Becerra. We are so privileged to have him join us again after joining us last year, a year ago, this month, for the release of the first ever national strategy to support family caregivers. He is a true believer in the work undertaken by both councils, and that is evidenced not only by his own background that I'm going to share, but by the fact that we have been able to get him to join us 3 times in the last 2 years, and that is a big thing. Let me just share a little bit about Secretary Becerra's background and why he has been such an incredible ally in our efforts. He began his legal career in Massachusetts fighting for the rights of people with disabilities. And then he spent so many years in Congress fighting to expand access to healthcare and strengthen programs like Medicare and Medicaid that are so critical to older adults and disabled people. And he brought that same focus on disability and aging to his work as Attorney General in California, including by starting a Bureau of Disability Rights in the Attorney General's office. He is and has always been a strong and impassioned advocate for caregivers and for policies that support caregivers. And as I'm sure he'll share again, he knows this work firsthand. He has been a family caregiver supporting his parents. He believes in caregiver supports and wants to build a better America, community by community, a nation where everyone is valued, everyone is included, and everyone can participate. He is truly a champion for building and strengthening what the president calls our caregiving infrastructure and is working to push all of us to make that a reality. It is such an honor always, and I yield the floor to you, Secretary Becerra.
Allison, first to you, thank you for all the work that you've been doing. The team at ACL is incredible. The fact that this has become a priority, not just for us at ACL and HHS, but for the President of the United States and the administration that has pushed this proposal forward, I think is a testament to the work that you and your team at ACL have been doing. So to you, tip of the hat for all the work that every day you all do to make this a reality. And certainly to the members of the 2 councils, the RAISE Advisory Council and to the Grandparent Advisory Council, kudos, hugs, whatever I can do, I pass it on to you because the work that you're doing is setting the cornerstone for what I believe will be the next generation of caregiving that will really be loving, supportive, and quite honestly based on family. Which to me is the most important aspect to this and the reason I want to participate every time I have an opportunity with you in these efforts. To all those who are not in government, who have been part of the councils or who are part of this effort to move this, thank you so very much. As you know, we are very far behind where we should be in caring for our loved ones. These 2 new laws that are in place that give our caregivers more attention, our grandparents more attention, crucial, but they don't get animated until we do the work. And so this is where it is such a thrill to get to partner with you. Allison is right. To me, this is a top priority. To me, this is personal. To me, this is family. To me, I grew up knowing that my grandparents would be taken care of by my parents or my parents' siblings. It was just the way it was. I've shared with you the story of watching my wife's mother pass in her home, surrounded by generations of the family in her home, all of them,
Hey,
including the young ones, the
you
tiny
said
ones,
people are having
going in to
issues.
say goodbye to their grandmother and great grandmother. It was an experience that I'll always remember. So much so that when my father reached his final days and he lived with me his last 4 years of life, we were there with him. He was surrounded by family as well. It's just the way it is. I grew up that way. I saw it when someone departs this earth, how it works. And so just having family around, there is nothing like the love of a family member to keep you alive. And by alive, I don't mean just breathing. I mean alive spiritually as well. And so this is so important what we do and what we have to accomplish. And we have to convince Congress that we've just begun. The cornerstone was just laid. We got a whole bunch more bricks to lay. And so I hope you will keep at it. I hope you know that Allison and her team at ACL, along with every other agency at HHS that is part of this team, along with the other sister federal agencies that are part of this effort, and along with all those external to the federal government who have been part of this process, are ready to work. And so let's get this done, because at the end of the day, this is personal, this is family, but it's also the right thing to do. We're going to save the government and taxpayers money. We're going to keep people alive longer. We're going to keep our hospitals a little bit emptier. And at the end of the day, those holidays will be filled with hugs and kisses with those that we love. And so thanks for everything you're doing. We're going to work this hard. By the way, you're going to help us elevate the work we're trying to do to bring up childcare in this country, pay people better wages, expand the number of childcare slots for families that need it. I just finished talking to folks in the nursing home sector and how we have to improve conditions there. It's all tied in, but it starts at home, personally, with family. So tip of the hat to each and every one of you. Let me put on the uniform. I will march to whatever orders you give. We're ready to work. Thank you very much.
Thank you so much, Secretary Becerra, for coming today, for sharing your passion, and for giving us a rallying cry. The rest of today, we are going to roll up our sleeves and really get to work. So thank you so much, Secretary. To the folks on the council, I really do not need to tell you, after hearing that, what a strong supporter we have in the Secretary, as well as the President and the Vice President. And I hope that that motivates each of you. Again, we have a big working agenda today, and so much of this is about how can we take this incredible national strategy and make sure it turns into reality. So RAISE and SGRG council members and members of the public, federal, state, and local partners, welcome. And thank you so much for your commitment to America's family caregivers. Last fall, through meetings such as this one, the councils created the first of its kind document, our national strategy, really a national vision of how we can move forward to support family caregivers. And again, I want to emphasize the same thing I said when we met kicking off the councils last time. It's not just about supporting family caregivers. It's about how family caregivers support an older adult, a person with a disability, a spouse. So it is a both and. We are about supporting the family caregivers and about supporting the people that the family caregivers are supporting. Since then, the strategy has been in early stages of implementation, and today's meeting is really going to focus about the fact that this is a living strategy and how we all are working together to change this and turn it into policy and practicality. I'm really excited to have the privilege of introducing the new co-chairs for the RAISE and SGRG councils. Thank you to everyone who was willing to step up. For RAISE, I am really excited to welcome Jonathan Cotter and Carol Zernial, and for the SGRG Advisory Council to welcome Keith Lohorn. I'm going to introduce each of them, and maybe if you could each turn on your camera while I am introducing you, that would be great. So let me start with Jonathan, who has been a caregiver for his son and his aging parents, and he has an incredible ability to meet people where they are, to understand their unique paths, to not measure the value of life in years, and to really, really support others. Jonathan has been a leader in corporate America, where he was recognized for really centering the ability of all people. And most recently, he is the founder of the National Center for Pediatric Palliative Care Homes. To his role as vice chair, Jonathan will bring all of his experiences, as all the council members bring to their role. So Jonathan, thank you so much for your work and for volunteering for this position. I'll next turn to Carol. Carol too will bring her lifetime of experience. She has 30 years of experience as a social gerontologist and has both developed and implemented programs serving caregivers at the local, regional, and national levels. Carol has successfully integrated caregivers as part of care teams in primary care in both Texas and Florida, where she learned about issues and disconnects between healthcare and the communities being served. Of course, she also brings her personal experience, having supported her mother who lived with Alzheimer's for 10 years. And she also knows the financial strains caregiving can bring, having almost lost her job when she took a leave of absence to care for her sister with cancer during the last 4 months of her life. Carol regularly drives 1,000 miles round trip to care for her 93-year-old father who is living in his own home. So Carol brings a lot of professional and personal experience to this job. Carol, thank you for agreeing to chair the Raise Council. And next, I will turn to Keith. Keith has served on several executive committees of nonprofit organizations, including serving for 16 years at the National Children's Advocacy Centers. On those boards, he served as secretary, vice president, president, and past president. He brings a wealth of knowledge about the broadcasting and news sectors to his role. He has been a news executive, primarily in the TV sector, where he played a central role in the New York Times expanding into the television marketplace. And for several years in leadership, he has been in leadership posts at the Alabama Associated Press Broadcasters Association. Keith is known for being helpful, organized, and able to foster decision-making, all great things to bring to a council. Thank you, Keith. So with that, we truly welcome and give our appreciation to Jonathan, Carol, and Keith as co-chairs of the council. So now I would like to pass the floor to Cheryl Thompson, who will conduct the roll call of members of the councils. Cheryl?
Thank you very much, Allison. And I ask the council members to turn on your camera when responding. So first I'll acknowledge Allison Barkoff, the chair, and the co-chairs, Carol Zernial, Jonathan Cotter for Raise, and Keith Lohorn for SGRG. And so we will begin with the Raise non-federal council members. Jesse Francisco.
Hello, everyone.
Thank you. Jonathan Cotter, we've already acknowledged. And Lynn Gall.
Present.
Felicia Gibson.
Present.
Neil Henderson.
Hello.
Sharon McDaniel.
I'm here.
And Daniel Murphy is unable to attend today.
I'm present.
Oh, hi, Daniel. Thank you. Denise Myler.
Good morning.
Nancy Ritchie. And I believe Nancy is on. Are you able to unmute?
Sorry, yes. Hi.
Wonderful, thank you. Gloria Sanchez.
Good morning, everyone.
Kezia Scales, Deborah Stone Walls, Jennifer Wolf.
Present.
Thank you. And now we'll move on to the raised federal council members. Liliana Chakrabarty will join us later, but Liliana, if you're on now.
Hi, yes, how are you?
Okay, wonderful. Thank you. John O'Meara,
Present.
Jody Sumaraki,
Present.
Catherine Capana, or alternate Diane Mitchell, Joan Weiss,
Good afternoon. Present.
thank you. Jolie Crowder,
Hi, I'm here. Thanks.
thank you. Melissa Gerald, and Melissa may be joining us later. Okay, Melissa will be joining later. Helen Lamont, Jennifer Bishop,
Present.
Rosemary Payne,
Present.
thank you. Jan Newsom,
Present.
thank you. Lisa Schipperly, Courtney Simmons, Sanchez,
Present.
Sarah Glenn,
Present.
Margaret Meg Cabot,
Good afternoon, everyone. I'm here.
wonderful, thank you. And that is our raised council. Is there anyone that I did not call your name? Okay, and now to move on to the SGRG, the Supporting Grandparents Raising Grandchildren, non-federal council members. Donna Aguiniga,
Present, and it's Aginaga.
Aginaga, thank you so much.
Thank you.
Anna Beltran,
Here, thank you. Looking forward to it.
thank you. Antesha Chesterton, Carol Cox,
Here.
Megan Dobin McNabb,
Present.
Bert Hayslip, Rainey Juski,
Present, and it's Jusky, like husky with a J. Much easier than it looks.
thank you. Keith Lohorn, and we had him earlier. Okay. Cheryl Miller. I know Cheryl will be participating around 1 p.m. Okay, and moving on to the Grandparents Federal Council members. Greta Kilmer,
Hello,
John Weiss already. I'm sorry, Greta, did you say present?
Yes.
Okay, thank you. Valerie Jones, Amelia Carricker, Emma Nye,
Present.
okay, Rosemary Payne is subbing for Elizabeth Sweet. Thank you, Rosemary.
Present, thank you.
Atalaya Sergi. Okay, and thank you, Valerie. I see your message. Beverly Yang will join us around 2 p.m. Becca Ortiz
Present, thank you.
and Tammy Proctor.
Present. Thank you.
Okay, is there anyone present or that joined after I began that I did not call your name? Wonderful. This now completes the roll call.
Great. Thank you so much, Cheryl. And again, thank you to all of the council members for your ongoing work to make sure this strategy is turned into reality, that all of us at the federal government are held accountable for the commitments that we made last year and for the work that we are going to do together, really looking at public comments and shaping what the next iteration of this national strategy should be. So with no further ado, I am going to hand the floor over to Greg Link and Lori Stahlbaum, who will facilitate the rest of the meeting. Greg?
Thank you, Allison. Thank you so much. It is great to be here, and good afternoon to the RAISE Family Caregiving Advisory Council members, as well as the Grandparent Advisory Council members. It is so great to see each and every one of you. We have a packed agenda today with a lot to cover, as you've seen from the materials that we've sent to you. But before we get started, I want to give my colleague and alternate designated federal official for this work and my true partner in crime in all of this, Lori Stahlbaum. Just give her a moment to say hello to everyone.
Hey, everybody, it's Lori Stahlbaum. I will be joining you later in the meeting for some hopefully continuous lively discussions like we had the last meeting. Look forward to talking with you soon.
Thanks, Lori. So for anyone who's been watching the work that we've been doing over the past several years to first bring to life both of these pieces of legislation, the RAISE Act and the Supporting Grandparents Raising Grandchildren Act, as well as to produce the initial reports to Congress, followed by the first national strategy to support family caregivers, you know that we've really got like a little small village here working with you, a small village of collaborating partners and organizations to really provide you as the council members, but also the nation, the country with tools and resources that they need to really begin to make inroads into implementing what we have in the strategy. And I can tell you that we would not be where we are today with a strategy that we have without these amazing organizations and individuals. So as members, new members of the Advisory Council, as well as a couple of our returning council members, we wanted to provide an opportunity for you to meet these key collaborating partners that you're going to be working very closely with during your time as a member of the council. And we wanted to hear about the work and the ways that they can support you. So first, for the members of the RAISE Council, you have the benefit of the knowledge, expertise, and technical support from our colleagues at the National Academy for State Health Policy. And through their grant from the John A. Hartford Foundation, NASHP has been instrumental in getting us to where we are today. And they stand ready to support the implementation of the strategy and to support you all with the information that you need. So first, I'd like to turn the floor over to the John A. Hartford Foundation, to my amazing friend and colleague, Ronnie Snyder, to talk about John A. Hartford's work in this space and how they came to be such a close collaborator with us. So Ronnie, the floor is yours.
Thank you so much. Thanks, Greg, and the full team, and Allison and Secretary Becerra. This is really exciting, and it's such a pleasure to be here with all of you to discuss how we can support family caregivers and grandparents who are also clearly caregivers, and all of whom are the backbone of care in our country. I'm Ronnie Snyder. I'm the Vice President of Program at the John A. Hartford Foundation, and caregiving is something that I and my organization are really passionate about. I'm here actually with my colleague, Scott Bain, who worked with me on this. And I want to thank the ACL and the Raise and Supporting Grandparents Raising Grandchildren Advisory Councils for all of your work. So here you see a little bit of information about the John A. Hartford Foundation. Some of you know us well, and to others will be brand new. We are a private foundation. We happen to be based in New York City, but we operate nationally. And we were established by the family owners of what you may have heard of as the Great Atlantic and Pacific Tea Company, or the A&P grocery store. And since 1982, we've been focused on improving the care of older adults. Next slide, please. This talks at a very high level about our mission to improve the care of older adults and the priority areas by which we do that. So we do that by building age-friendly health systems, by supporting family caregivers, and by improving serious illness and end-of-life care. And you can hear that these are three really interrelated and overlapping areas. I'll say we need healthcare to support family caregivers, especially during times of serious illness. That one sentence encapsulates some of this overlap. And we do a lot of our work through collaboration. Collaboration is really an overarching theme for us. So certainly that is true in our family caregiving portfolio, which has a goal of transforming our healthcare and social services systems to meet the needs of family caregivers by doing three things: raising awareness to drive change, improving the ability of health systems to support caregivers, and creating large-scale change in partnership with national efforts like this one. Next slide, please. Since the RAISE Act was passed, we've been really proud to work in close partnership, as Greg mentioned already, with the Administration for Community Living. To augment the federal work in 2019, our foundation made a grant to the National Academy for State Health Policy that Greg mentioned for what was then called the RAISE Act Family Caregiver Resource and Dissemination Center. The goal of the Resource and Dissemination Center has been to support the RAISE Council and the Administration for Community Living in the development and also the release of the national strategy and related activities. This has also included researching policies and evidence-based programs to better support family caregivers, again, many of you, convening experts to provide feedback to make sure that the advocates and folks who've been working on this for years and years are part of the work, and providing information to the public. So given NASHB's mission and working with states, NASHB also tested with states some of the ideas that are percolating in the national strategy, like special needs plans for duly eligible beneficiaries, assessing family caregiver support for enrollees. So next slide, please. And we have great news. Our collaboration is continuing and it's growing. So just last week, we renewed our funding to NASHB with a new grant that will begin next month. And that grant will shift the Resource and Dissemination Center, as it was previously called, to a RAISE Family Caregiver Implementation and Technical Assistance Center, because we're really excited to focus on action. So it's going to focus on three things again: engaging states and other organizations to drive action and implementation of the strategy's recommendations. This is super exciting to us. Supporting the uptake of the strategy by building a variety of partnerships and leveraging the lived experiences of family caregivers. And then third, implementing a comprehensive dissemination and communication strategy so that we're all together serving as a national resource for policymakers and for others to improve family caregiving policies. And I'll note here that we're really excited that we're going to work with new partners too, like the National Alliance for Caregiving. We have a grant with the National Alliance for Caregiving, or NAC, to launch what's called Act on RAISE. It's an advocacy campaign, which is completely separate from ACL and its work, but it's very much in support of the broader movement. That campaign is going to drive accountability around implementation of the strategy itself. It's going to inform prioritization of the actions, and it will ultimately strengthen our federal response to family caregiving. So together, all of us are supporting the implementation of the national strategy, and we look forward to partnering with the Supporting Grandparents Raising Grandchildren Council and its work as well. So last slide is just my thank you so much to the myriad partners in this work, Secretary Becerra, Allison, and all of the staff, Greg, your staff at ACL, as well as NASHP and our colleagues brought in as faculty to this specific work. National Alliance for Caregiving and the various advocates are such important voices. And to every one of you, new members of the councils, for your role in making this really important work successful. Back to you, Greg.
Thank you, Ronnie, for those remarks and for your extraordinary partnership over the past several years. I want to now turn the floor over to Wendy Fox-Grage with the National Academy for State Health Policy to share with our council members, but also members of the public, tools and resources that they've been working on, and an exciting new, I guess we can call it a campaign that they're launching as part of their work to really support implementation of the strategy. So Wendy, the floor is yours.
Thank you so much. It is so exciting to be speaking with all of you today, and it is such an incredibly great honor to be a council collaborator. And I'm so excited about the things that you all are going to be doing and working on and making life better for family caregivers. As Ronnie said, we have had a fantastic last week or two. We're excited. We were supporting the previous RAISE Council and its work, and we're excited to continue with your council in supporting implementation of the national strategy. Next slide. And there I am. I'm a senior policy fellow, and I'm with the National Academy for State Health Policy. The next slide. And just a quick word or two about NASHP. We're a nonpartisan, nonprofit organization, and we're of, by, and about state health policymakers. We're thrilled to be a part of this collaborative with both the John A. Hartford Foundation, ACL, the RAISE Council, and the many, many partners, and we'll go into those in just a little bit. Next slide. This is our RAISE Center. You can find all sorts of materials. We've now updated the website so that we have all the new council members, and it's just a wealth of materials. We are going to be, as you all collaborate and work together, we will be updating our website, which is nashp.org/family-caregiving. We encourage everybody to go on there. And as I said, we will constantly keep on tap and be updating with more and more resources and materials. Next slide. Today, I am thrilled to be announcing the hard release of supportcaregiving.org. At your last meeting, we were thrilled that so many of the council members were stressing the importance of communication and implementation of the national strategy. In order to assist and help with this effort, we've created supportcaregiving.org, and we have created a video that we hope will help explain to the public and others what the national strategy is. Okay, let's go ahead and roll the video, please.
Caring for a loved one can be rewarding, but it can also be a delicate balancing act that takes a serious mental, emotional, and even physical toll. Many struggle with the amount of time and money caregiving requires. And without support, it can quickly become overwhelming. When all of this falls on you, holding it together can often seem impossible. But we can work together to lighten the load. A new strategy provides hundreds of actions for federal, state, and local governments, businesses, and communities to take to support family caregivers. This historic strategy creates 5 building blocks to improve support. By improving education and awareness to highlight the unique challenges caregivers face, recognizing them as an essential part of the care team, strengthening the level of services and support for caregivers, ensuring their financial and job security through workplace policy and more affordable services, and turning research and data into better practices and support. Together, this is a plan that helps caregivers achieve the balance and stability they need for their families and for themselves. Learn more at supportcaregiving.org.
Great, thank you so much. And we hope that that will help explain the national strategy. We're planning on promoting that through social media channels, and we encourage all of you to please share that if people are wondering what the national strategy is all about. At the same website, we are so excited. Greg mentioned earlier that it takes a village, and we are excited to be working with a lot of the village. What we wanted to do is break it down and explain to each segment of the village, what are the strategies, what are the action steps that these targeted audiences can do to better support family caregivers. We are so thrilled to be now releasing resource guides. One is this, as you can see from the top, of how we can all work together. The first one is for family caregivers. What can family caregivers do for themselves? Employers, we worked with SHRM and others to create a resource guide for HR managers of how to better support family caregivers. Funders, we were thrilled to work with grant makers in aging to speak with their members, do research, and catalog both actions and promising practices. Plans, managed care plans, what can they do? And then, as we said earlier, my organization works with state policymakers. There's a lot that state policymakers can do. And so you can see the breakdown of, well, what can they do in respite care? What can they do with the direct care workforce? What are some broader state policies that they can, like caregiving, and what are promising practices? So click on and use these resources and get those out to your networks as well. Next slide. And here we want to acknowledge our partners. You can see them all on the slide who help put together resource guides. We also have more resource guides coming. We're going to, just like the national strategy is a living document, we're adding more resource guides because it really, the national strategy, I think the beauty of it is it's such a comprehensive document. We know that the federal government cannot do it alone. It takes all these different groups and all these different sectors to better support family caregivers. And with that, I do want to thank, I incredibly want to thank my team at NASHB for all of their hard work, as well as the Hartford Foundation, ACL, and all of the council members. I want to end with a big ask for all the council members and all the people watching this live stream. If you can help promote supportcaregiving.org, let's get this information out and let's try to share it far and wide. Thanks so much, Greg. Back to you.
Thank you, Wendy. We really look forward to the additional resources and implementation guides that you all will be developing over the course of our work together. Now, for the Grandparent Advisory Council, we have not forgotten about you. I want to give Anna Beltran, who's with Generations United, and also the director of the Grand Family and Kinship Support Network Technical Assistance and Resource Center, which is funded by ACL under a grant that we were able to make as a result of the passage of the American Rescue Plan. And Lori Stahlbaum is the federal program officer for this. But the work of the kinship, the Grand Families and Kinship Support Network, I think stands ready to be able to support and augment the work of the Grandparent Advisory Council. And I wanted to give Anna an opportunity to share some of their work and maybe begin the discussion a little bit later on about how they can serve as a resource both for the council as well as for implementation of the strategy as well. So Anna, the floor is yours.
Thank you so much, Greg. We're looking forward to working closely on implementation of the strategy. So my name is Anna Beltran. As Greg mentioned, I'm the director of this Grand Families and Kinship Support Network run in collaboration with ACL. If you go to the next slide, you'll see that when we talk about kinship families and grand families, we use those terms interchangeably to mean grandparents, other relatives, and close family friends who raise children when parents can't. And as you can see from these infographics, there are just many, many more children outside of foster care with relatives and kin that are inside the foster care system. But that's not to diminish their importance in the foster care system, because next slide, many of those children are in, and it's a different slide than I thought it was, but that about 35% of all children in foster care are with relatives. So it is kin are heavily relied on in the foster care system as well. So we have a 5-year cooperative agreement. We're almost at the anniversary of our 2nd year. Can't believe it's been 2 years. And our purpose is to provide assistance to state, tribal, territorial agencies around the country and nonprofit organizations that are in this umbrella. So we are not just focused on aging. We're not just focused on child welfare. We are focused on the array of agencies that touch and serve and should serve kinship families. So we're not working with the families directly because communities do that best. They know their laws, their policies, their programs better than we do. But what we can do is elevate what's working really well in certain pockets of the country so that others can replicate it and learn from it and pay it forward. So if you'll look at the next slide, these are amongst the things we do at the Technical Assistance Center, or what we call the Grand Families and Kinship Support Network. We host monthly webinars. Everything is free of charge thanks to ACL and their support. We have a website where we have countless resources. I think we have posted something like 80 in the last year. So many, many practical resources on that website. And we also respond to individual requests for assistance. And there's a button there. And you'll see on the next slide that we've gotten a good number of these kinds of requests over the 2 years. So these can be simple, like what area agency on aging out there is doing a really good job supporting kin? What child welfare agency has an excellent policy to make sure that children are with kin? Those kinds of simple questions, or they can be more complicated, like help us establish a kinship advisory council in our state. What are lessons learned? So we've responded to that array of questions, and we anticipate and are standby ready to support Keith, who I know very well, who's one of our grand voices at Generations United, and the rest of the council in our work together to implement the National Family Caregiving Strategy. So we're here and we're really eager to help and to collaborate. And on the next slide, you'll see a picture of our website. And please navigate around, sign up for our newsletter, which is on the next slide. We send them out monthly, so we're not gonna, take over your inbox. And this month's comes out Thursday, I believe. So if you sign up today, you will get the September Kinship Month newsletter. So like I said, Greg, Randy, Wendy, we're here as your partners. We are eager to collaborate together and support the councils. So thank you for letting us share what we are up to and how we can help.
Anna,
Thank you, Anna.
Thank
Wendy
you,
and
Wendy,
Ronnie
for providing us with that great information. Before we move to the next portion of the agenda, though, I did want to give our council members an opportunity to ask any questions that they have from either Ronnie, Wendy, or Anna. We have the opportunity. I think we have a little bit of time in our agenda. So if you all had questions, specific questions for them, please feel free to pose them. If you could use the raise hand feature at the bottom of your screen, that would be great. And if you had questions, just please let us know. Okay, yes, Jonathan, Mr. Cotter, you have a question.
I do. Thanks very much. This is very interesting. I love this. I have a question more for Wendy. On the NASHP implementation websites and the supporting the caregiver.orgs, is that very focused on the adult caregiving, or is it across the lifespan?
It is going to be across the lifespan. We have some that are focused on, so we have a variety of resource guides, and Jonathan, we really encourage everybody to click on that. We have some that are focused on, maybe older caregivers of older adults, but we are in discussions, in fact, right now with even more organizations to write other types of resource guides. So we're going broad.
Nice. Thank you.
Thanks, Jonathan. Any other questions? Carol, yes.
Get all my communications going. This question is for Ronnie, maybe to talk a little bit more about kind of the vision for the dissemination information piece that you talked about in the grant.
I would love to do that. Thank you, Carol. So we have this really beautiful collaboration between our foundation and, importantly, the folks who are doing so much of this work, the Administration for Community Living and the NASHP teams. And so our 3 teams come together frequently to work on the ways that we can get out the word. That includes disseminating the various resources and products that NASHP comes up with. It includes promoting the products and the things that you all, the councils, come up with, and making sure that we're all disseminating those. And sometimes when there's a big announcement like the RAISE strategy, we'll really go out of our way to find and work with media. We had a great media tour in the last grant that we did with NASHP that was really all about spreading the news in not only in English speaking communities. We also did a separate, had someone do a separate tour in Spanish who was supportive of this work. So it's really all about getting the word out. And then I mentioned the National Alliance for Caregiving. They're doing a very advocacy focused outreach as well. So it really is all about putting forth our best foot, and by our, I mean broadly this coalition, if I can call it that, and making sure that we're taking all the best advantage of this incredible opportunity historically so that we don't miss any possibilities.
Thank you.
You bet.
Any other questions? Okay, well, thank you all so much. And council members, as you will see, both NASHP as well as Generations United are going to be with us every step of the way, and we really look forward to that. So I want to move on to the next portion of the agenda, which I know is something that a lot of people have been interested in. The next presentation we have is an overview and analysis of the public comments that we received in response to the release of the national strategy last year. As everyone will recall, when the strategy was released last September, almost to the day, I can't believe it's been a year. On October 1st, ACL placed a notice in the Federal Register seeking comments from the public on the strategy. And this was really done to begin the work of informing the update to the national strategy that you all are going to begin working on very shortly. We know that the strategy as it exists will never be final, nor will it ever be complete. The RAISE Act also requires that the public be provided an opportunity to provide input on the strategy, its development, and its updating. And so the request for public comments was open for 60 days, and it closed on November 30th, 2022. And so with us today, we have Dr. Pam Nadash, who is an associate professor in the Department of Gerontology, McCormick Graduate School at the University of Massachusetts. And her work and that of her colleague, Eileen Tell, who could not be here today, is made possible through NASHP's grant from the John A. Hartford Foundation. And Pam and Eileen and their team were responsible for analyzing the request for information and carrying out a whole series of listening sessions and stakeholder interviews that informed the development of the initial report to Congress, as well as the national strategy. And then they came back to help us with analyzing the public comments. And so I'm going to turn the floor over to Dr. Nadash to provide us with an overview of the analysis and an analysis of the public comments that we got. And then we will have some focused discussion from the council members after that. So Pam, the floor is yours.
Hi, everyone, and welcome to all the new members. This is a great activity, and thank you so much for serving on the council. All right, so I want to do a brief introduction of myself. As as Greg mentioned, I'm a professor at UMass Boston. I'm part of the LTS Center at UMass Boston, and we do research and we really focus very much on policy and practice around LTSS. And my colleague in all this work is Eileen Tell, and she is a fellow at the LTSS Center. Unfortunately, she is unable to be with us today because she had a death in the family. So I am going to be presenting on her behalf. Okay, so we've all been working on this great project for a few years now. So this part of the project involved analyzing all the public comments and feedback on the national strategy. There was a great response, over 580 responses, and the respondents were asked to provide comments regarding what the 3 most important topics or issues are for the advisory councils to consider. And the reason this is super important is, as you all know, the national strategy covers so much. It covers so many different angles, and all of which are critically important to some people. And it's all a big ball of wax. A lot of the things that are suggested in one part are going to be supportive of something else. So it's really, really hard for you guys are going to have a real challenge in terms of deciding which issues to prioritize. And so this question was meant to elicit from respondents some guidance for you in terms of what they thought were the most important things to focus on. Okay. All right. And then can we go back this slide? And the next 2 questions were regarding, we wanted to provide people with an opportunity to note what was missing from the national strategy. Because obviously, even though we thought it covered a great deal, there might be some issues that people wanted to included in your consideration. And then we just wanted to provide people with an opportunity to add any other further comments that they so chose. And that was the question number 5, which asked for additional comments. So we analyzed all of that. Okay, next slide. All right, so just to give you an idea of the kind of respondents we had, we asked people to identify themselves, and we gave them the following categories. As you can see, a great deal of the respondents, 44%, were identified as family caregivers. Nearly half identified themselves as advocates. We had a good number of researchers responding, 13%. Some folks were employed by a government program or other organizations serving family caregivers. A lot of folks said they belong to more than one category. So as you might well imagine, many of the advocates, for example, were also family caregivers. No surprise there. All right, so that gives you a good sense of who responded to this. All right, next slide. All right, and what did they comment on? We also asked people, we thought it would be too overwhelming, given that the national strategy was quite a long document. We thought it might be too overwhelming to ask them to comment on the whole thing or provide detailed comments on the whole thing. So we gave people an opportunity to select which component of the strategy they wanted to comment on. And we also said that people could, if they wanted to, provide comments regarding different sections of the strategy. And so what we found was that most of the comments were in fact global, which is fine. And then the other sections were less frequently commented upon. So this just gives you an idea of what people focused on. The federal actions were some of the things people were most interested in. Okay, next slide. Next slide, please. Okay, thank you. So the top 3 issues for the councils. The priorities here tracked a lot of what we found in our previous analyses in terms of what people thought was most important. And consistent with the previous research, we found that goal 3 was what attracted the most comment. That section, as you know, was a bit regarding specific caregiver services and supports. And the things that were most frequently mentioned, consistent with the work before, was improving the quality, supply, and wages of direct care workers, with a lot of focus on training needed for direct care workers and all that other stuff that goes into ensuring that we have a quality workforce. And then also there were people really wanted to see much more attention paid to caregiver training and support, and of course respite, which again is consistent with the previous work where respite was identified as one of the top priorities for family caregivers. And then of course, increasing the supply and affordability of LTSS. Okay, next slide. So here are just some quotes from the responses. People wrote very heartfelt and detailed comments on all of this. There's so much depth there. People were so thoughtful in their responses. It's a shame I couldn't provide you with more information about that. But yeah, we slimmed it down to some of the interesting, this is fairly random, interesting comments that people made. And again, a lot of these centered on the workforce and prioritize addressing the direct care workforce shortage, enhanced training. Training was a key issue. All of this, a lot of these comments are about encouraging the development as direct care work as something that's meaningful and dignified and appropriately compensated. Okay, next slide. Okay, all right. Now, apart from goal 3, which addressed caregiver long-term services and supports really, the other top priority was goal 4, which is the financial and workplace security one. Again, these responses very much tracked what we found previously about this being a huge priority for people, their financial security, the financial impact of providing caregiver support, and again, paying family caregivers. This was identified as a key priority, encouraging states to develop programs to pay family caregivers, expanding access to self-directed services. And then also an entirely separate category concerned the workplace and making sure that people could leave their work place and care for a loved one, and implementing the range of policies that would support people staying in work and enabling them to be a caregiver while at work. Okay, next slide. Okay, again, here are a number of quotes illustrating these points. You know, one of the ones I always think is so interesting when I analyzed previous comments, there were a number of comments about the fact that family caregivers were not treated in the same way that caregivers of parents, people who are caring for young children were. So, and just this whole idea that it's very hard to survive in the workplace and be open about your need to provide care. Okay, and then also just a lot of comments about the financial harm people experience when they have to leave work to provide care. All right, next slide. There were also comments about kinship families and grandfamilies. And many times people commented on the fact that kinship caregivers simply are not treated the same way as foster parents or other types of family caregivers, and that a lot of kinship caregivers need a lot of the same services and supports. But there are different issues associated with this role. And many of them having to do with supporting children in school. And then in this last bullet point about the need for legal help and guidance, and the legal situation for these families is very tricky, and people do need help with those specific complex requirements. Okay, next slide. Other responded priorities. People very much endorsed many of the cross-cutting considerations that the council identified. And as I said before, the direct care workforce was one of the biggest issues, definitely identified as a top priority, as well as a huge endorsement for supporting diversity, equity, inclusion, and accessibility. Many comments concerned the inclusion of specific populations and the need to make different types of provisions or make an extra effort in order to serve different populations equally. And people also expressed support for family and person-centered approaches. Next slide. So, you know, all of the components of the strategy were top priorities for some people. This is what I was saying before. Everything in the strategy is important for everybody, for some people. And so this is not meant to, this summary does not downplay the importance. It's just meant to identify what most people said was very important. But we also heard a lot of people discussing the importance of raising awareness, which, you know, having listened to everything that's gone on, that's really been taken on board by the council. Again, this issue of caregivers being included as partners in the healthcare system and the LTSS system is critical. The need for data and research on family caregiving and developing products that people can use in terms of evidence-based practice was considered to be really important. And then this point here about the need to develop an accountability structure for the strategy, I'm going to talk more about that in a minute. And then also the needs for strong partnerships and collaborations. Okay, next slide. Next slide, please. All right, so now we're going to talk about the specific questions that focused on what's missing and the open-ended question, which was anything else anybody wanted to say. So next slide, please. Next slide, please. Thank you. Oh, go back. All right. So here we can see what people said was missing and what we need to focus on. So you can see that people wanted more focus on LTS services and supports. Also awareness raising considered to be important. And then all of these other issues, people also mentioned the need for more attention to them. Next slide, please. All right. So again here, sometimes I feel people use this question to re-emphasize their commitment to some of the topics that were raised previously. So in that way, the responses really did map a lot of the responses to question 3, the one about top priorities. But in addition, people supplemented that with specifics that were kind of extended beyond what was already included. And, you know, I can't really summarize all of that without getting into the weeds, but the focus really, again, mapped what were expressed as priorities previously, you know, direct care workforce, respite, caregiver training and support, the need to pay family caregivers, diversity, equity, and inclusion, and then the financial impacts of caregiving on individuals and the need to reform the workplace. And then, another theme in terms of what was missing was when people describe the specific needs of a specific population. And again, the national strategy is so broad, it's meant to be inclusive of a wide range of situations and populations. So it's of course difficult to make sure that each subpopulation is acknowledged, but people who supported people with intellectual disability and developmental delays felt like some people said that they felt like more attention was needed to those issues. Spousal caregivers, people with mental illness. Again, this is a population with very specific needs, and I feel that caregivers have very different needs than other types of caregivers. So some people sort of highlighted that issue. And then the issue of transitions, I think, is something that is also, I think, widely acknowledged as a difficult issue that needs more attention. Jesse, I'd love to talk to you, but why don't we wait till the end of the presentation, and then I'll take your question, okay? All right. Okay, next slide. Okay. And then another issue that was raised was the need to support research that evaluates the return on investment for caregiver support programs. So the idea here is that we need to be able to prove the value of these kinds of efforts. And again, that was a theme in our previous research, the need for data to establish the value of caregiver support, the value of employer supports for family caregivers. So again, it's extension of the same theme. And then again, the need to identify ways to share best practices. And there were some sort of, again, more specific issues having to do with the need for housing and end of life issues as well. Okay, next slide, please. Okay, so again, here we have a number of quotes. Here we have family caregivers of adults with intellectual disability should get Social Security. So that one combines a whole bunch of issues around that specific population, but also this broader issue around family financial supports for family caregivers. Yeah, so again, throughout the strategy, there's minimal acknowledgement of family caregivers for people with intellectual and developmental disabilities, especially children. And then this need to focus across the lifespan. Okay, next slide, please. Okay, so people also commented on what the federal government needed to be doing. There were a lot of comments that were specifically about the federal government's role. Next slide, please. And one of the big themes, which I think a number of people have mentioned in our discussion so far, was the whole theme of accountability. Now that we have this strategy, what are we going to do with it? And how do we make sure that we're on track to achieving the goals identified under the strategy? So there were a number of responding comments that were around that issue, and with suggestions about developing an implementation dashboard about the status of actions across federal agencies, creating a cross-agency task force for implementation that was public facing, so people could see what was being done and whether things were being achieved. So accountability was a big theme. And that was a genuinely new component to the research, which is suitable to the stage of where we are with the national strategy. Okay, next slide. And again, the ACL, it was identified as the key federal agency here. And so rightfully, many of the comments related to the ACL, and these mostly concerned expanding or implementing the national strategy, with some mentions of more specific populations or programs, including veterans, children with special needs, federal employees, and so forth. Next slide. Okay, again, lots of guidance, a lot of people telling the ACL what they should be doing. So the ACL needs to be issuing guidance to states. ACL, a lot of it was about what how ACL can support states. Again, the implementation dashboard idea. And then also, again, people were not distinguishing between what federal agencies can do and what Congress should be doing. So in some cases, we had comments that really translated into we need legislation. So in this particular case, prioritize the need for passing legislation and giving ACL the ability to do certain things. All right, next slide. So again, here, some of these are things that federal agencies can do, and some of them require support from Congress. Medicaid changes, for example, and streamlining eligibility. Some of these are expand the ability to pay family caregivers. Again, that's a consistent theme throughout all of the research. Include respite as a mandatory Medicare or Medicaid benefit. Improve access to mental health services. All of these are ideas that people were asking for. Next slide, please. Again, very specific comments about different mechanisms that could be used by the federal government. So I won't go into these. Give you a second to glance over them. Okay, next slide, please. Okay, and here people were specifically targeting what Congress could be doing. Again, tracking a lot of the responses previously, there were a lot of ideas around how Congress could introduce different types of tax credits or other mechanisms for relieving the financial pressure on family caregivers. So create a caregiver tax credit. And then this very political and tricky one around immigration reform. So no comment on that. That's a very sensitive topic. Expand benefits for working caregivers and including paid family medical leave. And the interesting thing here is that people were talking about the federal government acting as a model employer and in this particular regard, but there were also comments about that with respect to other components of a supportive work environment. Expand funding, of course. Establish a new Office of Caregiver Health at HHS. And then also support for the for tribal entities. Okay, next slide. I'll give you a second to glance over this. Okay, next slide, please. All right, what else is missing? Next slide. So people noted that the strategy is full of suggestions for collaboration, but that is easier said than done. I think it's critical to think about concrete mechanisms for ensuring that collaboration happens. And again, so a lot of this is just really about coordination mechanisms and how we do this. We need to have an infrastructure across federal agencies to ensure that there's collaboration around family caregiving topics. Data collection, again, needs to be coordinated, not just across federal agencies, but also across levels of government. So what the implication there is that states need to be, their data collection efforts need to be consistent with what the federal government's doing. We need to be able to compare across states and so forth. One suggestion was identifying a lead agency to shepherd the caregiver strategy and create a national resource center with cross-agency collaboration. Okay, next slide. And then with respect to accountability, mandate annual accountability on federal progress. And this, again, is the dashboard idea. Create a cross-agency task force for implementation with public meetings and progress reports. Prioritize equity across federal actions to address health and economic disparities. Again, support research and identify best practices and progress. Okay, next slide. And then again, there was all the work that can be done at the state level that states should ensure the paid family caregiver issue was again raised many, many times. And so the hope was that we could encourage states to do that as much as possible. And then, of course, if the federal government doesn't act on paid family and medical leave and various other things, there should be ways to encourage states to take action in the absence of federal action. And in particular, the CARE Act, which I'm not sure if everybody's familiar with that. So briefly, this is the legislation, the legislation that's passed at the state level that encourages the medical system to collaborate with family caregivers and include family caregivers in the hospital discharge process, so that when people go home, they know what they're doing. And even though, so really that legislation needs to be improved, and we have to make sure that it's implemented appropriately across states. And so not only do we need to be able to track implementation at the federal level about whether the strategy is moving forward, we need to track implementation at the state level as well. And then states also need to be sure to include family caregivers in state planning. So there were many comments to do with the state planning process and how that could be utilized, and coordination of funding needs to, a lot of comments around how states can make sure that organizations are collaborating appropriately at the state level. And states can also take a lot of steps to improve data collection. Okay, next slide. Okay, so Greg, do you want to pause and discuss this part before we move on to the other section?
Sure. We're gonna just focus for now on your analysis of the public comments section, and then we'll come back after the break and we'll talk a bit more about federal actions and the progress made to date. So thank you, Pam, for that incredible amount of work to analyze. We know that open-ended questions oftentimes are really difficult to begin to quantify and analyze. So you all did an amazing job. Before we jump into a discussion for the council members that's really meant to sort of hear from you what you feel, where you feel we can go and should go with these comments, and we've prepared some discussion questions. Did you all have any specific process questions for Pam about her analysis, the analysis that their team did? Specific questions? Jesse, I see you have your hand up.
Yes, hi. I want to talk a little bit about the training aspects. While I think training is overall typically a really great idea, can you talk specifically about what training specifically is going to be encouraged to states as sometimes states have used aspects of training to try and try and lower their numbers on home support services. So that's a little bit of a concern I have when we talk about training. So specifically, what training are we trying to fulfill?
Generally, when I'm talking about training in this context, it's about giving family caregivers the resources they need in order, the information, the skills they need in order to support somebody who has needs more appropriately. So, what we're talking about is, complicated medical stuff. Like if somebody's sent home from the hospital and they have to perform various types of, low skill medical tasks, and people are really super nervous about that, right? Changing a colostomy bag, those kinds of things. So training in that respect, but also training in a whole bunch of other kinds of ways around all the kind of information and advice you need in order to support a family caregiver. So that's the kind of training we have in mind. I hope that answers your question.
It does. It does. My only big concern about that is a lot of aspects of a person with disabilities life is very independent of what any sort of specific training can offer. And while I think access to those trainings is imperative, I would like to just add a little caveat when we talk to states and federal governments about when they try and instill these types of trainings to not make them mandatory to become caregivers, and instead mandatory as an offer to help caregivers with their clients better. And that's the only real thing I just want to clarify is what my position would be.
Great.
Thank you. That is a great point, Jesse. Thank you. Mr. Henderson.
Yeah, hi, thanks. One of the issues that was brought out was diversity, equity, inclusion. And I just wondered if the data was collected in a way that would allow you to break out ethnic minority responses or socioeconomic status. And might that be something to consider in the future?
We were not able to ask in a request for information in order to for the federal government to not have to go through a huge process of getting a survey instrument approved. We were not able to ask for any identifying information, but that I think that your point, Mr. Henderson, comes into how we begin to look at Goal 5 and the need for data and data in all regards, who's providing it, the types of individuals, their backgrounds and all of that.
And just to sort of comment that, at this stage, we were unable to specifically ensure a wide range of responses. In the previous stages of the research, we really did make a lot of effort to incorporate a wide range of perspectives. So even though it wasn't in this part, the national strategy itself was developed with a lot of consultation with a wide range of groups.
Thanks, Pam. So if we could move on to the discussion questions. The next slide, please. So council members, in the prep materials that we sent you late last week, and based on what you all heard Pam talking about from their analysis of the public comments, have you all had a chance to give some thought to like new areas that the strategy should address? For example, we have 5 goals and I don't know how many, 20, quite a few outcomes across those 5 goals. Are there new goals or new outcomes that we need to begin considering that you all would like to put on the table for development down the road? New sectors or actions that should be addressed? I want to throw this open to the council members. for your thoughts and ideas. We're going to begin taking all of this down, and also members of the public, you're welcome to drop comments in. All of this information will be tremendously helpful to the councils as we move forward. Rainey, you want to go ahead and kick us off?
Yes, I'd like to add that kinship caregivers, we've noticed a trend here in Georgia that they're getting younger. And this is a discussion that we had at the state level amongst the kinship caregivers here, that we all were seeing that. And a lot of the funding for supporting grand families is OAA money, which is restricted to 55 plus. So I'd like to put that on the table, that we need to consider that these caregivers of children, relative children, are getting younger, and there are fewer supports available to them.
Great, thank you. Others on new areas that the update to the strategy that you all are going to be working on, new areas that it should delve into, things that it didn't include. Pam laid out a whole list of things that the public thought the strategy needed to include. Bert Hayslip, I saw you put your hand up briefly, then you pulled it down.
Can you hear me now?
Yes, I sure can.
Okay. Well, one thing that I've worked with grand families for a number of years, and one thing that I become sensitive to is those personal or socio-demographic characteristics that make some caregivers more vulnerable than others. And I think perhaps more effort needs to go into, I'm not saying develop a profile, but it kind of approximate a profile to where you can identify key factors that are going to predict the worst outcomes for some caregivers, which would not work, or predict the similar outcomes for other caregivers. One that I'm kind of sensitive to, based on work I've been doing, is the salience of barriers that people must overcome to get access to services, and the differences between men and women as caregivers. Because my work suggests that men are especially vulnerable, not to say women are not, but that men are especially vulnerable. And this is in the context of grandparents raising grandchildren. That's all I have to say.
Sure. That's a great point. We've seen research, in the past few years begin to focus on the role that male caregivers take on, and some of the particular challenges that male caregivers have. And so perhaps as we look to, advancing the national strategy to support family caregivers, specific needs of specific types of family caregivers, including men, should be, one of those things that we look at. The same with maybe caregiving youth, some of the specific populations of caregivers. Gloria?
Yes, thank you. One of the things that I have found as a caregiver was that I really would like to see us work closer with the residential care facilities to see how we could partner or collaborate with them, so we can begin programs such as support groups that help our caregivers, and they're able to take their loved ones, and at the same time the facility can offer some respite for our seniors, for our caregivers, but also to take care of their loved ones during this time. Many caregivers do not attend support groups because they're unable to take their loved ones with them. So I'd like to see if we can foster some kind of partnership with them to look at the possibility, see if they can help us out in establishing some kind of adult daycare center for our family caregivers and their loved ones.
Okay, so sure. So expanding perhaps a combination of respite as well as support group services, combining them, so to speak, so that we can have a new type of support for the family caregiver, the care recipient dyad.
Yes.
Okay.
Thank you.
Anna? Yes,
Greg?
yes.
I was saying, it makes me think what we're talking about is inclusive respite.
Yes.
Where there's an activity that allows the caregiver and the care recipient, whatever that dyad or triad may be, whether it be in a facility or the memory cafes or in a lot of churches have, there's a lot of faith-based groups that have worked to offer sort of family respite where there's activities for the caregiver and the care recipient, both across the lifespan. So the types, not maybe, and not maybe just an adult daycare, but I think that leads back into goal 3 and respite and the need for a more expanded and enhanced view of respite as a dual need, not an individual need.
Great, thanks. Okay, we've got a lot of hands up and a little bit of time in this segment. So Anna, I'm going to go to you and then we'll go right down the line.
Thank you, Greg. I don't have new goals or outcomes to offer. I think it's a really rich strategy and, you know, kin are embedded throughout as our family caregivers. But I did want to react to Bert's comment because the need for data is so strong and we are working on that at the Technical Assistance Center. So I will get with you, Bert, and come up with some other data that we can mine. And then I also wanted to react to slide 11, where it talks about paying caregivers. And I can't speak to this on the family caregiving side as well as I can on the kinship caregiving side. But then on the kinship caregiving side, there's a need to move away from that language because of the guilt that caregivers feel about being paid and that they don't think they should be paid, and framing it more in terms of financially supporting them to meet the children's needs. I don't know if that kind of language tweak is necessary on the other side, but on the kinship side, it seems to be, but not diminishing at all the importance of financially supporting these caregivers. Thank you, Greg.
Thank you. Carol.
Yeah, let me get my videos. Yeah, I also want to, well, first I want to say that in my work with all caregivers, which has spanned like 30 some odd years before I got into grandparents, there is still this need for information about support services. People become caregivers. They don't know they're going to be a caregiver. This goes for grandparents and sometimes for adult children. And there is just such a desert in terms of what there is out there. How do they learn what's there? How do they access it? Are they eligible? And that's pervasive. It really is. And then with regards to other supports for caregivers, during COVID, I developed this program in New York, which was online Zoom calls for grandparents raising children. It was incredibly successful, very effective. We taught the grandparents how to use iPads. They connected from the house every week. My feeling is that this kind of support could be useful to all kinds of caregivers. It doesn't take a lot to learn how to get onto a Zoom call, particularly for grandparents and particularly for other caregivers who cannot leave the house, to know that once a week, twice a week, they can turn into a support group and get information and get it right from their kitchen or whatever. I think it meets a lot of needs, and I really think it should be expanded because people want to use Wi-Fi. They're able to use Wi-Fi. One of the issues, of course, is are they connected? And that should be something I think the feds should make sure that everybody has access to Wi-Fi nowadays. But I would like to put that in as a goal.
Great. Thank you. Thank you. Felicia.
Hi, thank you. So many things, especially in light of things that have just recently happened in my life. Definitely to piggyback about the phrase paid caregivers. When my husband was injured, I was told by the VA is awesome about trying to pay their caregivers, that, oh, you should be paid for this. And I agree 100%. The phrasing, because I was like, well, this is my husband and we had just gotten married and I felt like I didn't need to be paid to take care of my husband. Although now, 5 years out, I realize why, but I agree completely with the phrasing about that. As far as maybe sectors of actions that should be addressed inside of that training, not only for the caregivers, because I recently had my aunt passed Sunday or Saturday, and my cousin, who is 5 years younger than me, and his wife, who's even younger than him, were tasked with, they only had to take, she was only there for a week, but they were completely lost. The training from the hospital that she came from the hospice that they used was a little bit lacking. I don't know if there's a way to incorporate, because I know this is all like a federal on state and whatnot, but something with the schools like nursing, medical schools, just courses. I know it's not mandated by federal government, but to get them to understand that there's a need for them to teach the caregivers how to do things, even if it's not necessarily as extensive as like a colostomy bag, or like I changed my husband's super pubic, but they had no idea where to start. My cousin actually had training with my husband, my cousin had training with my husband's injury, and he said what was going on with his mother and my aunt was a whole nother ball game. Like it was completely different. And then also possibly with the financial aspect people keep bringing up, have we looked at helping people caregivers re-enter work for whatever reasons, whether it's their loved ones are getting better or their loved ones have been lost. I mean, that transition is huge. I've gone through it recently as well. And then I work for a small business. Part of the reason that I've had so many back and forths with that is because they aren't subject to the laws that some of these big corporations are. And I know we talked about caregiver tax credits. Is there anything for those, like to ensure that, hey, my small business doesn't have to adhere to this law, this rule, but a way for them to stay afloat without me for a while, to ensure my job, I guess. I know that was like 5 million different things, but
No, that's great. We'll go to Nancy and then Jonathan. Council members, if you haven't had an opportunity to contribute and you want to throw in some ideas, place them in the chat. We're capturing everything that is put into the chat, and this will be used to pull together a summary of where you all should be heading next with the strategy. So Nancy?
Thank you, Greg, and I'll try to make this quick. My perspective comes in this comment from the place of being a parent and caregiver of a young adult with intellectual disabilities, which of course, I think everyone realizes when you have a child with disabilities, that's a lifelong caregiving role. So there's elements of that I think other people have touched on that are very much in common. I think that Carol mentioned support groups and being able to connect with others at various stages in life. And I think for families of young people with disabilities, that is so incredibly important to learn from other families, what their journey has been like, who's the best barber in town to give my kid with autism a haircut, little things like that, just connecting with families and really learning and supporting one another through the various stages. And the other piece is within the world of raising an individual with disabilities. We say this a lot here in Pennsylvania. We let the local community off the hook so much by not pushing, and I hate to say push, but not challenging them to include our sons and daughters in the mainstream of life. Inclusion of people with disabilities, but also valuing their participation in community and what they can give. So anything along those ideas would be really, really helpful and appreciated, I'm sure.
Thank you, Nancy. Jonathan.
Like everybody, tons of stuff going on, and I love all this conversation. My mind, as I was listening through the comments and the analysis, was really focused on the implementation side of things and how are we going to help kind of turn this into action. And so what I would love for us over the next few years of conversations, because this is a big issue, but I would love to have tools in our tool chest. Could we develop practical tools that help the local or other organizations figure out how to navigate change in the sense of, does this let's take respite as an example. Does this require federal legislation? Because legislation was mentioned a few times. Or could we interpret an agency having the authority to just make a decision and issue a new, letter and make a statement? There's been a lot of effective change at the state level that has been new state legislation, but at the federal level, that can be really tough. And so amending regulations, how can we as an organization, as a council, how can we help provide the roadmap or just some basic kind of guidance for others to really say, hey, this really does, require federal legislation, or this can be done through an amendment. And then we can rally effort and family stories and people to kind of help. Sometimes an amendment is a lot easier to get done than legislation. So anyway, I think this group has the access to that expertise with NASHB and others to really help provide those tool chest items. That would be fantastic.
Great. And you make a great point. There's a lot of things that can happen at the federal level, at the state level, at the local level, some of which require legislative action. Others can be done through regulatory or rule updates, changes, what have you. And it's important to know the difference, especially when you're seeking to really facilitate change. And I think we're going to come back to that. So we're going to take about a 10-minute break. We didn't get a chance to get to the second set of questions, but we'll try to do that towards the end of the meeting. After our break, we're going to come back and have an analysis by Pam of the federal actions in the national strategy. And then we're going to hear report outs from our federal partners on the progress that they've made from around October 1st till March 31st of 2023 on the actions that they put into the national strategy. So we will take a 10-minute break. We'll be back here at 2:21 Eastern time. And so with that, we'll take a short break and be back in 10 minutes.
Are you trying to turn off your camera, Bert?
Hi, Lori. Were you saying something?
No, I was checking to see if Dr. Hayslip needed help, but now I'm stepping away for my 10-minute break.
Okay, awesome.
Thanks, Chantal.
Okay, council members, hopefully everyone's back. Okay, welcome back, everyone. We are going to move into the next portion of today's agenda, which is in addition to the public comments that I know the council members were definitely interested in hearing about, as well as our stakeholders who are tuning in to watch. The other huge area of interest is the progress that federal agencies have made since the strategy was implemented, or since the strategy was released last year. And so that's what we're going to be focusing on in this portion of this afternoon's meeting. Now, before we jump into an agency by agency update, what I want to do is turn the floor back to Pam Nadash, who, as part of their analysis of the national strategy when it came out, was to take a look at the federal actions that were in the strategy, and they did some just some basic good analysis of where all of those actions fell. And I think that'll provide a nice overview for the presentations that we're going to hear from each of our federal partners. So Pam, I'm going to turn the floor back to you, and we'll go from here.
Thank you, Greg. Okay, so as Greg said, essentially the goal here was to look over all the federal actions and sort of try to figure out who's doing what and where the bulk of activity was taking place. So next slide, please. So the first sort of analysis we did was to look at which of the goals was getting the most federal attention. And so I don't think it will surprise anyone that the goal getting the most attention is the first one, which is really around the raising awareness component. And so obviously the federal government that's one area that the federal government can take a lot of action on. And then the second area that got quite a bit of attention is goal 3. Now, goal 3 is around services and supports for family caregivers, and what the federal government can do to support those long-term services and supports. Next was goal 2, which is actions to advance partnerships and engagement with caregivers. So this covers the range of things having to do with incorporating family caregivers into care teams. So a lot of this goal is around the healthcare system as well as the LTSS system. And then goal 5 is around research. I think one of the things you see consistently across this is there is a great deal of emphasis on research. It's consistent throughout. It is not the most important thing, of course, but I think we all recognize the importance of it. And so obviously the federal government can do a lot to support research and data and supporting evidence-based practices in LTSS. And then lastly, goal 4 is around financial security. Now, the reason I would say that this is the one receiving the fewest federal actions is no doubt because a lot of this has to do with private sector action and supporting and encouraging private sector action. There are things that only employers can do and things that need to be employer-led. So I don't know what did the slides disappear for everybody or just for me?
Yes, give me 1 second. It appears that I just lost signal here on my end. Give me 1 second.
Okay, I've got them on my slide on my computer, so I can keep speaking to them while you're working on that. Okay, so the next slide had to do with the number of federal actions by responsible agency. So essentially all this was an analysis of which agencies had the most actions. And what we found was, no surprise here, that ACL has a primary responsibility for executing the national strategy with the 76, I think, was the count of specific national strategy actions that okay, next slide there. Sorry. Oh, sorry, 93 federal actions were that ACL is responsible for. So we can see that ACL has an awful lot to do. Next up is the Department of Labor, which probably speaks to a lot of the employment related and direct care workforce related actions in the strategy. And the CDC also has quite a lot of responsibilities here. Again, likely having to do with the various healthcare related supports that can be given to family caregivers. Other agencies that had a lot of federal actions assigned to them were CMS, the Centers for Medicare and Medicaid Services, which is part of HHS, and NIH, which conducts a great deal of research around family caregivers and is responsible for some of the data and research activity. That's the National Institutes of Health. There are a lot of acronyms here. So, and also we see the VA because I can't remember the name of the new council member, but as we know, the VA is very, very active in trying to support family caregivers of vets. So we see a lot of actions assigned to them. Okay, and so just glancing at this, you can see that there are a wide range of federal agencies assigned to them, assigned with actions. Most of these are sort of health related, but we also have a lot of other agencies that are not specifically health related that are working on this, including the CFPB, which is the Consumer Protection Bureau. So there are a lot of different angles on this, as you all know. Okay, next slide. Okay. So again, the other thing we thought might be interesting was to understand the distribution of federal actions with respect to specific populations. Being very conscious of the issue raised previously that some populations might be getting more attention than others. So we really wanted to kind of think about how federal attention was distributed with respect to these federal actions. So, I mean, the bulk of federal actions pertain to all populations. So when we were analyzing this, there were like a lot of things that were just family caregivers. So you can see that the majority of federal actions relate to all family caregivers. And there is, specific attention to kinship families and grandfamilies. There are a number of federal actions, relating to them. And of course, the important thing to remember is these are just counts of federal actions. Each of these federal actions is not necessarily the same as the others in terms of the amount of effort or, how much money will be associated with them. So these aren't one-to-one comparisons at all. Some of these are huge programs and some of them are smaller, very specific actions. So this is only kind of a rough guide. I mean, this should not be taken as, truly reflecting the level of federal activity in any of these areas. It's really a rough approximation of how much attention is being paid to each specific group here. But we do see that the one group that does get the most specific mention among these federal actions is the group of people living with dementia. I think that reflects, the difficulty of supporting that particular population. But anyway, so let's see. So those are the care recipient populations, and then there are also the caregiver populations. And what's interesting here is you'll notice that there are a lot more categories specified, because some programs are really, or actions are specifically focused toward these specific caregiver groups. So we had, for example, this new group, employee caregivers. But only 4% of the federal actions are targeted at that population, probably for the reason I mentioned previously, which is this large private sector area. And then we also have, again, caregivers of people living with dementia having a fair amount of federal actions targeted toward them. Yeah, again, we have family caregivers. The reason we created that category was to just where they were distinguished from kinship or grandfamily caregivers. But again, the most actions did not specify which caregiver population was being targeted. All right, next slide. Okay, that's actually it. This section probably didn't get the level of analysis that the first bit did, but I hope that's helpful to you. Thank you.
Thank you so much, Pam. And that really, the reason we wanted to have Pam talk about their overview of sort of what was in the federal actions and how they shook out across the various goals and categories and sectors is that we wanted to move now into, I think, one of the areas where I know a lot of our stakeholder community has been very interested in hearing the progress to date on the federal actions. And so that's what we're going to move into now. And then with our council members afterwards, we'll engage in some additional discussion regarding where things go. So before I begin introducing the progress that we've made in each of the goals, I want to just provide a little bit of overarching contextual framing for what you're what we're about to talk about. First of all, ACL has been tracking and working with all of our federal partners to make sure that they, understand, the scope and intent of what the RAISE Act calls for, and in terms of how, federal programs are working within their existing scope, as indicated in the RAISE Act, to really better support family caregivers. But I want you all to keep in mind a couple of things as we're hearing the report outs from the federal agencies. When we're looking at progress that each agency has made between October 1st, 2022 to March 31st of 2023. So it's a very limited 6-month time frame. Since this is a new effort and we are developing our progress reporting cadence, we have not yet settled on a regular reporting schedule. We saw in the public comments that there should be annual accountability. That will be for the council members' discussion and how often we need to be reporting, and also adding new actions to the strategy. Second, you all are going to be likely hearing from some of the federal partners to some of the challenges we as federal agencies experienced in implementing some of our actions. In the federal government, just like anywhere else, priorities can shift, and new priorities can force us to put aside what we thought we were going to be doing at the time, or even change how we undertake a particular activity. A lot of this has to do with the shifting policy environment, funding structures, and policy priorities of the administration or a particular agency. And as we're going to hear from a few of the agencies, a number of us have had some new opportunities that have arisen since the strategy came out. And so some of the things that we may be hearing were things that were not even on the strategy because they weren't on our radar screen or they weren't possible at the time. Again, in the federal government, it's often very difficult to predict a year or more into the future what we will be permitted to do or will have the resources to do. And so oftentimes we seize an opportunity when it becomes available to that. All that said, like I mentioned before, the strategy was delivered with the understanding that it's a living, breathing document, and it's never going to be set in stone. It's always going to be changing, growing, refocusing as our broader policy and program environments in which we consider these issues change. So I want to just give a very high level overview of the progress made in each of the goals. So if we can go to the next slide, please. Next slide.
Okay, my apologies. I'm gonna have to ask for Cheryl to go ahead and take over. I'm having some connection issues over here.
Okay. While we're pulling up the progress slides, I just do want to give a shout out to each one of our federal partners to say thank you for your incredible collaboration since the strategy has come out. The level of enthusiasm and commitment to the strategy, to the work that each of you has done, I think speaks very highly of the importance of this issue, not only to this administration and to the respective agencies, but to each one of us who populates and sits on the advisory council in a federal capacity. This issue is deeply personal to most of us. It is for me, and I know it is for many of my federal colleagues. And so I think this is something we can really sink our teeth into, and something that has great meaning. And so I'm just waiting for Cheryl or Chantal to pull up the slides so that I can quickly walk through an overview of the federal progress, and then we're going to jump into an agency by agency update of the progress that has been made between October and March. Do we have the slides?
Yes, hi, Greg. We're going to pull the slides back up.
Okay. I think you need to go to slide 53. Okay. So just to recap, you know, when we developed the strategy, when the strategy was developed, it was the two councils coming together around 5 shared goals and one vision for how the strategy should shape up and the areas that it should address. Next slide, please. So as of March of 2023, under goal 1, we saw that we had 65 of the actions, 117 total actions, 65 of which were in process, 13 complete, and 31 which had not yet been started. And remember, when the strategy was developed and the federal actions were placed on there, some of them, we asked agencies to look 2-3 years out into the future. So some of them have not started because they're not due to start yet, but we anticipate that they will. So keep that in mind as you're looking at those not yet started. That's not necessarily a bad thing. And then there were 8 modifications to some of the actions in goal 17 for whatever reason, shifting policy environments, shifting priorities. So it's the world in which we live. Next slide, please. So goal 2, you can see that we had 55 total federal actions, 33 of which were in progress, 8 of which had been complete. Next slide. And then goal 3, the same, 67 in process at one point or another in their development or implementation, and 12 had been completed. Next slide, please. And then for goal 4, the financial and workplace security, 4 of the actions had been completed, 16 were in process, and a couple had not yet been started as of March. And then finally, goal 5, next slide. We see that we had 31 in process and 8 complete. So all in all, a lot of activity, and it's still ongoing. If we can go to the next slide, what I'm going to go ahead and do is kick off the federal agency reporting, because since ACL had the lion's share of the actions, I figured we could go first. We had, as Pam said, we had 93 actions as a total across the strategy. As of March, 6 of them had been completed and 41 were in process. So, for example, if we look under goal 1.1, which was in process back in March, ACL had committed to re-establishing these 2 advisory councils. This took more time than anticipated. This was one of those things where we set an ambitious goal to have these 2 new advisory councils seated, let's say March or April. Well, the vetting process it actually took much longer than we had anticipated, and we actually didn't convene the councils until July of this year. But now they're up and running, and here we are. So under action 1.8, our administration on disabilities began working to establish a community of practice across 10 states that are funded, currently funded by the Bridging Aging and Disabilities Network projects, to develop consensus regarding the needs and challenges of people with disabilities and their families. Action goal 1.10 was also completed. Our Center for Regional Operations completed more than 5 hours of education and training on family caregiving at this year's Title VI conference. Title VI of the Older Americans Act addresses Native American, Native Alaskan, and Native Hawaiian populations. And there were a total of 5 caregiving related workshops in this conference. Initially, the goal had been 1 workshop in that conference, and there were a total of 5. So our Center for Regional Operations exceeded that. Our CRO, Center for Regional Operations, also provided specific information and guidance to the states that this year that were required to submit new state plans on aging for how to incorporate and address the national strategy in their state plans. As of March, Action 1, Goal 1, Action 15, our Office of Elder Rights began the work necessary to ensure that grandfamilies needing legal services opportunity for the Legal Assistance Enhancement Grant programs. Our research arm, the National NIDLR, our Research, Rehabilitation, and Training Center on Family Support at the University of Pittsburgh began implementing their goal setting procedures for family caregivers of older adults enrolled in the Community Aging in Place Advanced Better Living for Caregivers or CAPABLE program. And under the Goal 5, Action 3, our Office of Performance and Evaluation will pilot the addition of a new question on older adults receiving Title III services in the Older Americans Act to ask if they are also family caregivers. This is a connection that we have not to date really looked at among the service recipients of Title IIIB supportive services, and this is going to start this fall. And I'm really excited to announce one new initiative that was not even on our radar screen when the national strategy came into being. And that's later this month, Lori Stahlbaum and I will be launching our Caregiver Projects of National Significance. Following the receipt of our 2023 appropriations earlier this year, the decision was made to implement some of the new demonstration authority that was restored in the 2020 reauthorization of the Older Americans Act, specifically under Title IIIE, the National Family Caregiver Support Program. And so we are launching 5 demonstration grants. The announcement will be going out on Thursday. We'll be launching initially 4 demonstration grants, 1 in each of the goal areas, goals 1, 2, 3, and 5. And we're going to be issuing a notice of funding opportunity for a Technical Assistance Center grant for goal 4 in the coming weeks. We're also launching a new Technical Assistance and Resource Center to support our aging and tribal and kinship support networks to better implement the requirements of the strategy across OAA-funded caregiver support programs. The Technical Assistance Center is also going to be implementing the Title Section 373E requirements, which is the gathering and dissemination of best practices in the National Family Caregiver and Tribal Caregiver Support Programs. And that TA Resource Center is also going to be implementing the Technical Assistance for Caregiver Assessments, Section 373J, that was added also in the 2020 reauthorization. So all of that work will be kicking off later this month and beginning early in October. So very excited about that. And there's a lot more to talk about moving forward. So that's the ACL update. And I'm going to turn now. Sumaraki from CMS. Do you want to go as one of our key partners in this work?
Sure, Greg, and I might end up going off camera because I don't know whether your connection was kind of giving you a hard time, but mine is giving me a bit of a hard time here and there. So it may be that I go off camera, but we'll see how it goes. So I am Jody Samaraki. I serve as the Senior Policy Advisor in the Medicaid Benefits and Health Programs Group in the Centers for Medicaid and CHIP Services at CMS. I am delighted to be here today and to continue participating as a federal member of the RAISE Advisory Council. It's been an honor to be part of this work. And as Greg said, you know, a lot of us carry a lot of personal value and energy behind this work, and I really appreciate being part of it. Much of the work that CMS chose to include in the initial strategy centered really around sharing of information about CMS programs that impact and help support family caregivers, provide technical assistance to states, and the development of trainings, webinars, stakeholder engagement, and educational materials. CMS took on 28 actions as part of the initial strategy. And in terms of an overall progress update by March of this year, 6 of those actions had been completed and 20 were in progress. I wanted to quickly highlight a couple of those accomplishments in particular. The first is under goal 1. I believe it was under outcome 1.4, which was that CMS, it was DHPG at the time, which was our old name, but now it's the Medicaid Benefits and Health Programs Group, will conduct by July of 2023 a national training on the home and community-based services funded through Medicaid that could be of benefit to supporting family caregivers. In February of this year, MBHPG conducted a presentation during a national all-state call that provided information on the available methods states can use to operationalize payment for family caregivers in their Medicaid programs. Due to high demand, an encore of this presentation was conducted in June, and I will drop a link in the chat to that presentation, and I believe there's a recording of that as well that folks can access. We provided additional information about these state options a couple weeks ago at the National HCBS Conference. And even though this happened after March, I wanted to acknowledge that we, under goal 2, outcome 2.1, I think it was, that CMS listed that CMS would publish by fall of 2023. The proceedings of a state summit, convene a technical expert group, work group, and disseminate action briefs that communicate strategies for supporting individuals with intellectual disability as well as their aging caregivers. You know, we know that an estimated 1 million households in the U.S. include an adult with IDD who lives with and is supported by aging caregivers, and that this number is growing. And we also know that, you know, as adults with IDD and their caregivers age and experience life transitions, that they may need new and additional supports. With that in mind, in June of 2023, CMS released 4 action briefs, which were designed primarily to support state Medicaid and partner agencies that play critical roles in the designing and delivering of services and supports that meet current and future needs of adults with IDD and their aging parents and caregivers. The resources included strategies that state Medicaid and partner agencies can leverage to anticipate and meet the needs of adults with IDD and their aging caregivers, including strategies related to this services, supports, data management, and partnerships. Highlights of ways that states can design and implement person-centered planning processes to support adults with IDD and their caregivers throughout the lifespan. A resource sharing strategies states are using to address the needs of aging caregivers, including assessment, training, and navigation support. And a state spotlight resource that highlights innovative strategies that states are using to support adults with IDD and their aging caregivers in 4 areas of focus, including building interagency partnerships and relationships, providing engagement and navigation supports, implementing person and family-centered systems of support, and planning for the future. These resources are part of our larger ongoing efforts to provide states with information and additional tools to support individuals and their caregivers, particularly in light of the ongoing direct care workforce crisis. In terms of challenges and opportunities, we've, during implementation of the federal actions connected to the initial strategy, I'd say one of the biggest challenges for us at CMS is always being able to kind of forecast future actions and estimate timelines within which they can be accomplished. And Greg kind of noted a little bit about this when he was speaking a little bit ago. There are multiple factors that influence and shift the timing and scope of things we do in government, and we have to be steadfast but nimble in continually navigating those shifts. It can also be challenging to capture everything happening that could be of importance to family caregivers across an agency like CMS that has multiple business lines and related work streams. I look at this, though, as an opportunity as well, because this process, along with other similar cross-cutting initiatives, really gives us the opportunity to connect with colleagues within our own agencies who we might not have otherwise connected with. And because this is an iterative process, we have the ability to make updates ongoing and highlight additional actions in future versions of the strategy. So I think I took more time than I was supposed to, but I'll close just by saying that a lot of work has happened over the last few years to get us where we are. And I'm excited to see how the strategy continues to evolve over time and the collective difference we can make in the lives of family caregivers and the individuals we serve. Greg?
Great. Thank you so much, Jody.
Sure.
We're going to move next to the VA, another required partner in the RAISE Council. Meg Cabot, are you there and ready to provide an update?
I am. Thank you very much. And as my previous colleague stated, I'm also thrilled to be here today to give you just really a brief update on all that VA has been doing over the past couple years since the strategy came out, was published, but also update you on a couple of things where VA has been able to take advantage of other things that are going on with VA to really focus in on our caregivers. So as was mentioned earlier, we have 21 actions across all of the different goals. Several of them are within awareness and outreach because we do have so many different kinds of services available, a lot of education and training to family caregivers in a variety of different buckets. And I like to talk about the two different buckets of training, one where individuals are really understanding their role and their change in role when they become a family caregiver. So sort of getting that support and really beginning to understand their role as a caregiver. And then that second bucket is sort of the how-to guide. How to support someone, a loved one with dementia, how to change a bandage, how to change out a prosthetic device, all of those kinds of things. So we have all kinds of programming that's available in both of those buckets. So we want to do a lot of awareness and a lot of outreach. We've done that in many different ways, some of that directly to our caregiver community, and then some to the veteran community in general. So for example, we have a newsletter that's called Vet Resources that compiles all kinds of different information that goes out weekly to a listserv of over 13 million people. And occasionally we will target specific caregiving resources as part of that kind of mass mailing that goes out on a regular basis. But then, of course, there's also caregiver specific listservs and things like that. So two things I wanted to highlight. One is around goal number 3, which is around services and supports provided directly to family caregivers, and specifically around recommendation 3.3, which is increasing the availability of counseling, training, etc. So one of the things that we've been able to do under that recommendation is really expand the way that we are providing mental health services. You know, back in 2010, a piece of legislation was passed that required VA to provide mental health counseling to caregivers of veterans. And while we offered those services, it was really very difficult for us to provide those services, really for two different reasons. One was caregivers didn't necessarily want to come to the medical center because then what was going to happen with the veteran, the care recipient. So that was one very large issue. And the second issue is that the the mental health resources at any given medical center or clinic were often really already overtasked. So, during the pandemic, VA's telehealth capabilities just really increased by hundreds of times over, and we were doing all kinds of really innovative telehealth for our veterans. And so our very creative caregiver team jumped right on that bandwagon and were able to really expand the kinds of mental health treatment that we can provide directly to caregivers through using telehealth, which is a much better medium for our caregivers in many cases. So what we did was, what VA has done in terms of telehealth generally has created what we call clinical resource hubs. And these are places where a lot of infrastructure is developed, all the technology is there to do the telehealth, and we'll have a whole series of providers who then can provide telehealth all across the country. So what the caregiver program has done is funded psychotherapy professionals, social workers, licensed professional counselors, psychologists, to provide psychotherapy directly to caregivers at several of those hubs. We started out in 3 different regions of the country, and we're moving into several more by the end of this calendar year. And we've already funded more than 55 professionals, psychotherapists, and we've provided almost 500 visits, and my data is a little old here, so it's probably more than 500 visits to almost 120 caregivers. So, this is really something that we're excited about, because it's really not only helping caregivers get that help that they need, but it also is giving us a better strategy to reach caregivers where they're at. So excited about that. And the second thing I just wanted to mention very quickly, actually 2 other things. VA was able to partner with the Rosalind Carter Institute to develop a toolkit for emergency preparedness. And this is something that VA does a lot anyway, really very focused on making sure that our vulnerable veterans in an emergency situation, whether that be usually a weather emergency, have everything that they need. And so this is a toolkit that was developed specifically for caregivers to help them be prepared in emergencies. So I'd encourage you to check out our website, caregiver.va.gov, that has information about that, has that toolkit there. So it's really available for anybody to use. And while it's specific to veterans, it certainly is applicable to caregivers in many other situations as well. And the last thing I will say is that just a few months ago, and I don't have all this data in front of me, so I apologize for that, we did launch an aspect of a law that was passed a couple years ago to provide not only financial but also legal support to family caregivers participating in VA's program of comprehensive assistance for family caregivers. And now caregivers are able to work with either a legal professional or a financial professional to get certain services and supports to really help them as they continue along in their caregiving journey. So that's all I was going to share, Greg. Thank you for the opportunity.
Thank you, Meg, so much. We're going to jump over to a colleague of ours at the within the Department of Health and Human Services, the Administration for Children and Families. Liliana Chakrabarty is going to talk about some of the work that ACF has been up to since the strategy came out. Liliana?
Sure. Hi, everyone. Thank you so much for joining us today. So I wanted to highlight some of the work that ACF has done. Overall, we had listed around 14 actions. There's 7 of those that are completed. I'm going to be referencing more of the Children's Bureau actions. Our colleagues from Administration for Native Americans are working on some new grant opportunities. So once those grants are awarded, then we will be sending you that information. But I wanted to highlight really with goal 1 and outcome 1 around Americans are educated about and understand the experience of family caregiving. We have really done a lot at the Children's Bureau through our contracted providers of the Capacity Building Center for States and our Child Welfare Information Gateway to create various different online resources and videos that talk about kinship caregivers experiences. So I'll put that information in the chat afterwards, but we have an It's All Relative guide that is a supporting kinship care discussion guide and video series. So we really want to make sure that all of you are using these materials that talk about the experiences of kinship caregivers, mainly grandparents, but other relatives as well that are taking care of children, you know, either formally in child welfare in foster care or outside of the system as well. And our team from the Child Welfare Information Gateway interviewed 5 of our different kinship navigator programs. And so they have podcasts that are available speaking with those kinship navigators about the services that they're providing to families. And I'll put those in the chat. It's referencing the states of Rhode Island, Washington, Nevada, New Mexico, and Fort Campbell. As many of you know, we've been funding since 2018, all of the states and our Title IV tribes, which is now 12, and they are in the process of developing and expanding kinship navigator programs in their state. So we provide reference to Goal 2, kinship navigator constituency group. So we have quarterly webinars with those states where we're highlighting best practices. So we just had our kinship care webinar last Wednesday, and we had the state of California and their Think of Us kinship navigator program present along with the state of Connecticut and how they are developing their program, really using a racial equity lens. And then we also had one of the tribes, our Loop community of St. Paul, talking about engaging those with expertise. I also heard about training before, so I'll put in the chat. The Children's Bureau did fund a cooperative agreement grant, which developed the national training and development curriculum for foster adoptive parents and for kinship caregivers. So there is on their website a specific training materials that were created for kinship parents and building the resilience of kinship caregivers. So again, this is a free online resource, so please feel free to use that in the future. And then the most important thing is that in Goal 3, we are waiting, hoping any day now, that a notice of proposed rulemaking that was issued that will change the licensing rules. So right now, Title IV agencies, so state child welfare agencies, receive their federal Title IV foster care maintenance dollars. And the rules are that for whether you are a licensed kinship caregiver or a non-relative, you have to follow the same licensing standards. So in February of this year, the administration was committed to doing a notice of proposed rulemaking that will make that change so that states will be able to have different set of rules for kinship caregivers than for those non-relative caregivers. So we are hoping that that is going to be published soon. And then once that happens, we will be having a virtual town hall and a webinar to talk more about that opportunity. So I'll put those links. Thank you so much in the chat. Thank you so much, Greg.
Thank you, Liliana. Thank you, Liliana, for the ACF update. Emma Nye from ASPE, are you on and ready to provide an update from the Assistant Secretary for Planning and Evaluations Office?
I sure am.
All right.
Is my video on? We're good.
I don't see you yet,
Yes.
but okay, yeah, okay, great.
Yep, so I'm Emma Nye. I'm a public health policy analyst in the Office of Behavioral Health, Disability and Aging Policy within ASPE, which, as Greg said, is the Office of the Assistant Secretary for Planning and Evaluation. Quite a mouthful. ASPE, for those who aren't familiar, is the principal advisor to the Secretary of Health and Human Services on policy development and policy coordination, legislative development, that sort of thing. So we took on 6 actions in ASPE's role. Those are research projects. So we had 6 research projects that were focused on family caregivers as of March 2023. I can go pretty quick. So as of right now, all of those research projects are completed, but we're still working through publishing reports on a few of them. So not everything's out yet, but the research itself is all done, which is really exciting. The one I wanted to highlight is one that I led. It was under Goal 5, which is to expand data, research, and evidence-based practices to support family caregivers. So this project, which was called Supporting Families and Caregivers of Adults with Behavioral Health Disorders, examine the unique needs and challenges of people supporting an adult with a mental health or substance use disorder. The project included a technical expert panel that hosted researchers, caregiving support program providers, public health leaders, and people with lived experience of behavioral health caregiving. So the project, like I said, is complete. The report's currently moving through our clearance process. Hopefully it'll be out later this year or maybe early 2024. I can't give like too much detail because it's not public yet, but this was such a, I mean, I love being on this council because it's full of people who care so deeply about caregivers and are just so impassioned, and it's always a joy to be here. But this panel was just such a moving experience. I can't wait to share it with you all. These panelists spoke so passionately on the challenges that they faced or their clients have faced in finding supports, the unique and magnified needs of these caregivers, and then all the bright spots, those spaces for action and progress that we're trying to do in this council. So I'll stop there because I can't say too much more, but and I want to leave it open for other people to speak, but I'm excited to share this research with you. I will post what is out in the chat. I saw someone asked about that. And thank you for your time.
Great. Thank you so much, Emma. Do we have colleagues from the CDC on? John or John O'Mora or other
Hi, Greg.
colleague? Hey there, how are you?
Great, thanks. Yes, Greg and I are both here.
Excellent. I'll let you go ahead. I'll let you both take it away for CDC.
Perfect. Thank you, Greg, and the team at ACL, and hi, everyone. And thank you also both to the new councils and everyone who's joined us today. So my name is John O'Mora. I'm a medical officer on the CDC's Alzheimer's disease team. And as Greg mentioned, I'll be co-presenting with my colleague, Greta Kilmer, who is the CDC's federal member on the Grandparents Advisory Council. So CDC took on 41 actions, all of which I will classify as in process as of March 2023. Technically, some of them we did classify as to be modified, but those modifications were really just minor tweaks to some of the language. So in reality, they were all in process. We had 18 actions under Goal 1, 3 under Goal 2, and then 10 each under Goals 3 and 5. And so then in terms of something to highlight for you all, we really wanted to highlight that under Goal 1, Outcome 1.4, CDC committed to a federal action to update the Healthy Brain Initiative 5-year roadmap by 2024. In case you're not familiar, the roadmap really establishes national priorities for public health regarding brain health that include actions regarding dementia caregivers. And those actions are then woven into the National Healthy Brain Initiative overall, as well as our BOLD award recipients. So BOLD is Building Our Largest Dementia Infrastructure award recipients. And so we are really excited to report that even since the March reporting, this action is now complete. The new roadmap was released just in June of this year, so June 2023, and it is called the Healthy Brain Initiative State and Local Roadmap for Public Health 2023 to 2027. I'm holding up a hard copy in case, hopefully you can see it on my screen. So just a bit of detail about the roadmap. So it really uses a framework consisting of 4 domains, and those domains are built on the 10 essential public health services as well as Public Health 3.0. So those 4 domains are, the first one is to strengthen partnerships and policies. The second is to measure, evaluate, and utilize data. The third is to build a diverse and skilled workforce. And the fourth is to engage and educate the public. So you can see a lot of synergy certainly with the national strategy to support family caregivers. And so then those are the 4 domains that sort of structure the roadmap. And then there are a set of 24 actions that are offered that map onto those 4 domains. And those actions are really oriented to public health departments and their partners to consider that implementing to advance brain health amongst the communities and populations that they serve, including amongst caregivers. And so caregiving is really integrated and represented throughout the roadmap and its actions. And in particular, the goals and outcomes of the national strategy to support family caregivers were taken into consideration during the development of the new roadmap to ensure alignment. So just to give you one example, there is an action which we number E7, so it falls under that domain of E to engage and educate the public domain. And so that action is to ensure that caregivers have information, tools, and resources about their vital role and ways to maintain their own health and well-being. So again, this can be used as a potential action item for public, state and local public health departments, as well as other jurisdictions and organizations. So we really encourage you to check out the new roadmap. You can find it on our website, and on our website there are also other supporting documents, including an executive summary, a what's new document, and an introductory video. So thanks, and I'll hand it over to Greta.
All right, I'm Greta Kilmer. I'm an epidemiologist, and I'm going to continue with some updates from the CDC related to public health data systems. So many of our actions relate to data and improving current data systems regarding caregiving or pursuing new ones. The data system that we use the most is the Behavioral Risk Factor Surveillance System, or BRFSS. And they recently released 2022 data available for public use. In terms of improving data systems in 2022 to 2023, we undertook a structured approach to modifying the BRFSS caregiver module. And one major consideration was to reduce the number of questions across BRFSS in general to help reduce the respondent burden and ultimately try to improve the response rates. So the proposed modifications for the caregiver module were developed in conjunction with a process to solicit input, feedback, and ideas from a group of caregiving experts and data users. The group discussed how to revise the module to ensure current question language meets the population health data and state programmatic needs. Additional input on revised questions was solicited from several people currently living with early stage dementia and their caregivers. So the current version of the module has 9 questions, and we're pleased that the revised module will also have 9 questions, which have been revised and modified. We think the questions in the revised module align with our goals around caregiving data and will help serve public health activities broadly. So these questions were approved and will begin administration in 2024. So to wrap it up, we also pursued inclusion of caregiving questions on the National Health and Nutrition Examination Survey, or NHANES, by submitting a letter of intent and then a full proposal. In terms of pursuing new data systems regarding caregiving, it can be challenging to get buy-in to include caregiving content on questionnaires and surveillance systems. And again, this is in light of general trends to decrease the content on questionnaires to reduce responder burden. But we continue, and you all know we need to pursue this, including through education and awareness and all that. So that's all from us.
Thank you so much, CDC. Really appreciate it. Joan Weiss from the Health Resources and Services Administration. Are you on?
Hi, Greg. How are you?
Hey, Joan. How are you? Good.
Good. Hi, everyone. I'm Joan Weiss. I'm the Deputy Director in the Division of Medicine and Dentistry at the Health Resources and Services Administration, which we call HRSA. So HRSA addressed 15 actions in the national strategy, and we are currently in progress on all of them. And I'm going to report out on 2 of our actions related to goal 1.1, which is Americans are educated about and understand the experience family caregiving. So this our actions are that HRSA is going to continue to support its webpage on caregiving to achieve goal 1 of the strategy, and action 45, which is HRSA will continue to have a caregiver representative on its Federal Advisory Committee on Interdisciplinary Community-Based Linkages. Just briefly about the curriculum and training. A few years ago, HRSA developed a caregiving training, which was initially designed to assist caregivers of persons living with dementia. However, the curriculum is broad and it's flexible, and it can assist caregivers who are also providing care to older adults who have one or more chronic conditions. The training consists of 2 parts. The first part focuses on helping caregivers, and the second part addresses ways health care providers address caregiver needs. So the helping caregivers training portion teaches caregivers on how to take care of their own health and help with the challenges of caregiving. It consists of several modules on dementia, decision-making, assisted living considerations, choosing a nursing home, working with the healthcare team, self-care, and addressing behaviors in dementia. And the second portion of the curriculum helps providers understand and address caregiver needs. And these 4 modules address providers and caregivers working together as allies, how to include caregivers in shared decision-making, ways to interact effectively with caregivers, and caring for caregivers. I have a link to the training, and we'll put it in the chat. We really don't have too many challenges with this activity, as the training is already developed. However, we are continuing to work on disseminating it widely, and what we really need to know is what are the caregiving organizations that could benefit from this type of training. It is free, and as I said, it's on our website. The next activity that I'd like to talk about is our advisory committee on interdisciplinary community-based linkages. This is a federal advisory committee that provides advice and recommendations to Secretary and Congress on policy and program development on specific education and training programs related to primary care, geriatrics, and mental health. And our geriatrics programs are required by statute to provide training to patients, families, and caregivers. And I said to myself, like, we have all these members from different disciplines of medicine, nursing, social work, psychology, but no caregivers. And I just thought it was very important, especially given my work with ACL's Family Caregiving Council, to really make a push to get a member, a caregiver on the committee. So I didn't have too many challenges doing that. I just making the case, and it was really hard not to accept the request. So now we have a member. We've had a member on for 2 years, and she's going to be coming off on this in next year. And we already have another caregiver lined up to replace her. So I'm just thrilled about our work in both of these areas, and love being a member of this committee and hearing all the challenges that you're facing. And I listen to them and take them back in my work to do my best to address them. So thank you so much.
Thank you, Joan. I really appreciate it. Next, we're going to turn to our colleagues at the Indian Health Service, Dr. Jolie Crowder.
Hi, can you hear me okay?
Yes.
Excellent. Just a little background. Indian Health Service provides care and services to 2.8 million American Indian and Alaska Native people across the country who are members of 574 federally recognized tribes. For those of you who don't know, the Indian health system is a little bit complex. It includes Indian Health Service run facilities, tribally run facilities, as well as urban Indian health organizations. The bulk of funding, care, and services actually goes out and is provided by tribes who manage and self-direct their own care. Our goal at the agency level is to engage and provide support across all three parts of the system, which collectively employs tens of thousands of employees, including a direct care workforce. IHS itself employs about 15,000 people, 2/3 of which are direct care workforce. Our elder health team within the Division of Clinical and Community Supports is new, with our first staff brought in the fall of 2022 as a result of 2021 congressional appropriations. So we're excited. We have had Dr. Fink, who has been tirelessly working on behalf of elder issues for nearly 30 years here, but excited to have actual paid full-time staff. We had, I think, about 12 or so actions. Some were kind of similar, filtered across the different goals in the plan. We've completed 6 of those, and then all the rest are in process. As is the case with a number of other agencies, many of our activities actually support more than one goal. So a quick run through of the completed activities, specifically under goal 1. We had talked about just writing a blog about caregiving, which is a really new term and subject matter, I think, for most American Indian and Alaska Native communities. We actually decided to approach it from social media perspective. And we had a social media campaign that we did last November for National Caregiver Month. And then throughout the year, we've actually tried to create some specific content that, ties back to the caregiving message, including like defining what caregiver is, because that's a term that really doesn't resonate in our communities. One of our November Facebook posts actually ranked in the top 10 for engagement across all of our IHS social media platforms, which reach almost 100,000 people. So we were pretty pleased with that. And I think that kind of the consistent drumbeat of messaging is far more likely to reach more folks than sort of the one-time blog. We also are in the process of onboarding a new communications contractor, and they're going to help us with observances and engagement. We also had in September some posts about Grandparents' Day. So one of our other tasks was to incorporate some caregiving resources and links on our IHS web pages, and we've done those. We also have engaged with actually 3 of CDC's bold centers of excellence that are addressing dementia. Specific to this work is the Dementia Caregiving Center of Excellence at University of Minnesota. Dr. Goglier, who runs the center, is also a partner with one of our grantees there in Minneapolis and is supporting their work locally on caregiving efforts. We also funded 2 new ECHO series this year. If you're not familiar, an ECHO is really designed for clinical staff and includes case-based learning and then discussion and a little bit of didactic training. It's a pretty successful model, and Northwest Portland Area Indian Health Board does a really great job of hosting multiple topics for ECHOs across the country. We have one of those is a caregiving ECHO. It's actually co-led by Dr. Neil Henderson, who's our lead faculty. Dr. Henderson actually created one of the only 2 caregiving interventions that have been adapted for use in tribal communities. And I'm also excited to say he's also a council member here. So great to have that representation. Any given month, we have 30 to 50 participants who come on to talk about caregiving. We have shifted a little bit, I think, in how we approach the ECHO from a strictly sort of medical focus to incorporate, instead of cases, stories. And we find that storytelling as a means of communicating just works better, I think, with folks. So another really critical part of our caregiving activities our Alzheimer's grants, which is principally the reason we received appropriations. We were successfully in awarding 4 grants in fiscal year 2022. And if you stay tuned, on September 21st, we'll be announcing the award of a new batch of grantees that are both tribal and urban Indian health. That funding allocation across the years that they're funded is going to total about $4.2 million. And we have 5 drivers of comprehensive dementia care, one of which is caregiving. So all of them are required to address that. We have some new evolving caregiver focused work that wasn't in the plan before. As a new agency priority, we have been seeking some appropriations to address cancer care, which has never been officially funded for the agency. We're in the midst of developing a strategic plan to address cancer, and caregiving was actually identified as a cross-cutting theme. So I've been supporting the work of that group. And also IHS participates in another federal council focused on cancer that has a cancer focused work group. Looking into 24, we're hoping to host an informal work group that includes ITU staff, community members, and subject matter experts to support our work to examine models of caregiving, coaching, interventions, and support for adaptation. Focused on people living with dementia. We also hope to use that group to get feedback from tribal participants on the priorities for caregiving services and supports in local tribal communities, including those that we might be able to support at the national level. And another big priority for us is figuring out how to incorporate caregiving data elements into our future EHR system, which is currently in process in terms of selection and implementation, but that's probably going to take a few years. In terms of challenges, a lot of these were brought up as sort of goals and objectives or outcomes in the report. But I think, the 4 that come to mind to me specifically, sort of big picture, is we need terminology that can be used between clinical and community staff in our tribal communities. We just consistently hear over and over that when we put out even social media materials that talks about caregivers, people who are like family caregivers, it doesn't resonate. So it's like slipping right past them. So every time we're putting out a resource or a guide or mentioning it on our website, it's most likely slipping past the vast majority of people who are in our communities. I think that tends to be the case in most minoritized communities, or many, particularly those who have a really community or family-centric focus. For us, I think it means a major push, either at picking a new term, or, I think an effort that we can't do alone, which is really getting out down at the community level to explain to people and help them understand what a caregiver is and who they are. So practically speaking, if we're not all speaking the same language, everything we create is going to fall flat. I think the other big challenge for us, which is related to our upcoming work with the EHR, is we really need a means to identify, track, and manage caregivers in electronic health records, both the patient's records as well as that of the caregiver. The ITU system collectively doesn't use one single EHR. Everybody, the tribes all choose their own, urban organizations choose their own. And so it puts us in a pickle when we're trying to figure out how to update EHRs, which is not as simple as it might seem. It's really critical, I think, to use clinical settings to create work, and they need workflows and connections to push the flow into other communities. So it's really, I think, an initiative that needs to come at a larger level than just IHS, with both public and private folks from the industry. I think the 2 other items, I know Greg wants me to wrap up, sorry. We desperately need interventions and training designed for both paid and non-paid caregivers that are developed by and with minoritized communities, such as tribal communities. The second best option is formal adaptation and then evaluation, but that doesn't happen very often. We just assume they're going to work, and they're not. And that's a hard ask for us with limited funding in that space. And so That's, I think, hampered our efforts in just picking things and pushing them out. I think the other piece is attention and support, across the board when folks create resources to supporting true plain language materials and guides that are not just created, but also tested with low literacy populations for health literacy aspects. There's a lot of great resources, and unfortunately we find that if they're not written in a way that are user-friendly, short and sweet, that our folks in the workforce as well as caregivers themselves just aren't opening them. So that's it for me. Sorry, thanks for running a little long, and appreciate the opportunity, Greg.
Not a problem. Thank you so much, Dr. Crowder. We're going to turn next to Melissa Gerald from the NIH, National Institutes on Aging, for their update, and we'll hear from what Melissa has to say.
Hello, everyone. I'm happy to be here. I'm just on a brief break from the National Advisory Council on Aging's meeting, where right now, as we speak, they're considering funding for several new caregiving relevant grants. So I'm eager to hear what they recommend. So I'd like to just give you a brief overview of NIH's progress toward meeting our goals. First of all, NIA, National Institute on Aging, we take the lead for NIH in reporting on our caregiving activities. We're only one of 27 institutes and centers across NIH, but we lead the federal government in conducting and supporting research on aging and health and the well-being of older people. And so placed in the context of our mission, we support and conduct genetic, biological, clinical, behavioral, social, and economic research on aging. We foster the development of research and clinician scientists in aging and provide research resources. And we disseminate information about aging and advances in research to the public, healthcare professionals, and scientific community, among a variety of different audiences. And so the actions that NIH took all relate to intersect with each of these arms of the NIA's mission. And as of March of 2023, we already completed 5 of these action items, and 14 were in progress and will remain in progress for time to come. And several other of our action items will be modified along the way. And so the majority of our actions were related to increasing awareness of an outreach to family caregivers, goal 1, and goal 2, advancing partnership engagement with family caregivers and strengthening services and supports for family caregivers, goal 3, and goal 5. That's where the lion's share of our actions are. And that's in expanding data research and evidence-based practices to support family caregivers. So I'm going to report on some progress that we made toward goal 5. And this is that last goal, and 5.1. And this is calling for the national infrastructure that would support the collection of population-based data. And so NIA issued 2 companion requests for applications to solicit research proposed in grants, small and large, that are focused on methods and measures for research on family caregivers for people living with Alzheimer's disease and related dementias. And the purpose of these funding announcements were to support research that could lead to the development of methods and measures for capturing expanded definitions of family and related concepts related to informal caregiving for people living with Alzheimer's disease and Alzheimer's disease related dementias, and for the implementation of these measures in new and existing studies. NIA published the intention of committing nearly $4 million in fiscal year 23, this one right now, for 5-year R01 grant awards, and an additional $1.36 million towards supporting 2-year R21 awards, and I'm thrilled to report that we funded 9 new grant awards through these funding announcements. And as I mentioned, there are other grants that were also funded in these areas, but 9 new ones just in response to that funding announcement, those 2 companion announcements alone. How this action is going to impact family givers and the people they assist. A number of adults are aging, and they're aging without spouses or biological children, and they're leaving older adults with limited access to some of the most common current sources of unpaid care. And at the same time, the prevalence of ties such as stepkin, non-marital romantic partners, that's also increasing. And also are members of blended families, families of origin, families of choice. And they share a kin-like relationship, but they're not connected by biological or legal ties, but they may be playing a really important role in providing informal care for people who don't have spouses or children, for spouses or children who are unable or unwilling to serve in a caregiving role. And we really hope that the research that we're funding is going to help lead to the development of measures and methods that can better capture, better reflect the families out there and the expectations for and the exchanges of and care therein, to better understand the contribution of these people, their impact and the consequences to them in society, and identify potential sources of unpaid care for individuals living with Alzheimer's disease and related dementias. Some of the challenges that we encountered while trying to address the different actions, like so many others in the world, NIA-funded researchers were also greatly impacted by the pandemic. Social distancing measures were limiting the ability of researchers to go to their labs, to reach participants, and to collect data, which many of the participants are older and vulnerable, and as are their families and their care partners. And they were already, as you all know, as why we are here now, are also faced with these burdens related to caregiving, and that was even before the pandemic. So that's caused numerous delays, which we hope are going to subsist. But nevertheless, our researchers are moving forward, and I'm really thrilled to announce to you all that NIA has issued several new initiatives since we last reported our updates in March that are directly related to caregiving. I know we don't have much time, so I'm just going to instead of describing them, I'll shout out the titles so people can look these up. We have a funding announcement on the streets right now on health equity and the cost of novel treatments for Alzheimer's disease and related dementia. We have one on primary care-based screening tool and intervention development for the detection and prevention of abuse and neglect in older and vulnerable adults who are at risk of mild cognitive impairment and Alzheimer's disease and related dementia. We're going to be continuing data collection, development, and dissemination of NHATS, National Health and Aging Trend Study, and the National Study on Caregiving, NSOC. And so this is to get asked, I'm going to just tell you, it's to provide additional research opportunities for the National Health and Aging Trend Study to formally study Alzheimer's disease and related dementias and disability. We also have an announcement out on the streets on State Dementia Care Research Center. And so this is to help improve dementia care coordination, integration, and care transitions in community settings, and also to inform policy. And we also are we're soliciting grant applications for a consortium on economic research on Alzheimer's disease and related dementia prevention, treatment, and care. And so I think that those are all of the updates I'd like to offer you now, but we have lots going on as we speak. So thank you so much for having me. I can't wait to continue with our efforts.
Great. Thank you so much, Melissa. From SAMHSA, do we have Elizabeth Sweet? We are running pretty close, very close to our time, and I have a few more agencies to get through. So if we can keep our presentations as tight as possible, I'd really appreciate it. But Liz, go ahead.
Thank you, Greg. From SAMHSA, I am here representing also Rosemary Payne, who had to drop off. We had approximately 12 actions, which we have been working on implementing. And so what we have is raise recommendations under 2.2. And in September of 2022, we had a collaboration with the Administration on Children and Families, and that focused specifically on substance abuse and child welfare. We facilitated a webinar. We also have had 812 people who participated in that webinar. We've had 2 additional webinars, one which Greg was kind enough to participate in, that focused on specifically the issues of caregivers where substance abuse is an issue, and a second webinar which was focused on where the caregiver is providing care for a child with a serious emotional disturbance. Recommendation 3.1, we have done an increase in access to meaningful and culturally relevant information services and supports for family caregivers. We have also been involved with 3.1 and 3.8, increasing kinship families and grand families access to information. We have been providing partnership with the VA around the Governor's Challenge to veterans to prevent suicide among service members and their families. And we have had a 3-part community learning series entitled Addressing the Caregivers Crisis, How States and Communities Can Better Support Military Communities and Their Veteran Caregivers. We've also provided an initiative. We are developing and just beginning the conceptualization of working on an initiative with emergency services and FEMA to develop a curriculum using caregivers, providing peer support models during emergency situations. Our challenges have been staff turnover and clarifying the terms around caregiving. Thank you, Greg, for the opportunity.
Thank you so much, Elizabeth. And moving right on to some of our partners outside of the Department of Health and Human Services. AmeriCorps, Sergey Italia, you're up next.
Oops. Hi, thanks, Greg. Hi, everyone. Good to see you all. So yes, I'm Italia Sergi, the director of AmeriCorps Seniors and representing the AmeriCorps agency. So AmeriCorps Seniors is the office that has been leading on this work. We are a grant-making office. We have 3 signature programs. 2 of those programs, our RSVP and our Senior Companion program, are really the programs that focus on this work and can support caregivers. The Senior Companion volunteers are focused on independent living and respite services for older adults and people with disabilities and helping their caregivers in that way. And then our RSVP program can provide a variety of services. They do a lot of educational activities in their community. They do work in respite as well, benefits navigation, helping people to get connected to services that they may need. So those are the 2 programs for us that are doing a lot of work. And as an office, we are working across objectives 1 through 3 in different ways. A couple of things that we have been doing. AmeriCorps Seniors has really been committed to supporting increased public awareness We are both doing this both for our grantees. We have about 1,100 grantees that all engage older adults in volunteerism. So we have been making sure that they understand the needs of caregivers and making sure that organizations doing this work know about the grant opportunities that we have at AmeriCorps Seniors and what might be available in our other AmeriCorps programs within the agency. So recently I was able to engage with Arch National Respite Network and Resource Center to talk with the Learning Collaborative on volunteer and faith-based respite and shared with those organizations kind of the benefits and importance of engaging older adult volunteers in this work, some of the values and the skills that they bring to the work, and also was able to share with them some examples of current grantees that are doing this work from our Senior Companion and RSVP program. The other thing I was able to share is our grant opportunities and examples of those grant opportunities that will be coming up shortly that those organizations can apply for. I was also on a panel with one of our newest grantees, which is a demonstration program that I'll share a little bit more about later. So it was really nice to be able to have a grantee there to share how they were using the grant funds and how they were working on these issues. We are also including information in our monthly newsletters that go out to all of our grantees. We are doing this throughout the year and then doing a focus, did a focus on this in November, and we'll do that again. This is meant to help our directors in our grantee organizations that run our programs understand the needs that are in their community and how they might be able to respond to those needs. We're always asking them to make sure that you are investigating needs in your community that your volunteers can support with, and then helping them to make that connection. The other thing that putting it in our newsletter and sending it out to our directors that work at our grantee offices is that they also share this information with their volunteers. And so we know that many of the volunteers that are in our programs could be caregivers. Some of them are caregivers, we know that. And then we also know that our volunteers typically share information throughout their social circles. Beyond the volunteer work that they do, they share this with their families and with other friends and people that they may be neighbors that they're living next to. And so we wanted to make sure that we get this information out. It's a way of doing it through our programming, but also just getting it out into the community. We also have every year we have a convening where we bring all of our grantees together for training. And we invited Generations United this year to present at that convening and share information with our grantees. So we will continue to put out invitations. We have another convening that is coming up this year. We don't have exact date yet, but we're working with our contractor to get that wrapped up as soon as possible. So we'll be inviting others to come and share about the needs of caregivers and how our programs can support them in their communities. So we are also taking any opportunities that we get to explore how we can support caregivers in our grant opportunities. So AmeriCorps Seniors, one way we've done that is AmeriCorps Seniors has been developing and rolling out a funding opportunity that support older adults. Our volunteers are 55 and older, so supporting anyone 55 and older for employment. So using service and volunteerism as an on-ramp. Within the AmeriCorps agency, we have several of these types of programs and opportunities that are focused towards our younger members. But given the needs that we're seeing in older adults that need to return or stay in the workforce and the desire to change careers sometimes, I felt like it was something that we should be also doing to support our older adults. So we developed a demonstration or a pilot to support, to use service in order to get that on-ramp to employment. And in 2020, we were able to award a demonstration grant to Lifespan of Greater Rochester in New York. And this is a 3-year, $2.8 million grant to use service and volunteering as an on-ramp and training platform to increase the respite care workforce. The outcomes that we're looking for is through service and helping individuals get the training and certification they need, that they can become professional respite care providers. The grantee, they are using and implementing the respite educational and support tools training module, which is an evidence-based intervention to really help get those individuals that are interested ready to be able to access employment and get into some of the networks there so that they can provide respite to families. So those are some of the things that we've been working on, and we will continue to keep pushing with everyone else. So thank you so much for the opportunity to share.
Thank you, Atalia. We have just a couple more agencies to go. Council members, we may wind up doing is flexing the last part of our agenda just a little bit, because I really think it's important for you all, as well as the stakeholders and public that are tuning in, to hear all of the great work that has been going on at the federal level with the actions that we committed to in the national strategy. So I'm going to turn now to our colleagues at the Department of Labor. Sarah Glynn.
Thanks so much, Greg. Hi, everybody. We're very excited. DOL loves the Raise Council and the work that we're doing in this space because we understand the importance of family caregivers to our economy and to our workforce. So I'm going to quickly run through just a few top level things. We have a lot that was in the national strategy, and I'm going to put a lot of links in the chat as well for folks who are interested in more information. One really great example comes from our Office of Federal Contract Compliance Programs, which oversees contractors and subcontractors to the federal government and make sure that they're in compliance with all of the laws and regulations related to that, including anti-discrimination measures. And you might think, how could contract compliance have anything to do with caregivers? Caregivers work everywhere. And so we are able to make sure that they're centered in all of the work that we do. So OFCCP has just recently updated their process for compliance evaluations of contractors in order to gain additional information that will better enable them to determine whether or not contractors have discriminatory policies in place that are based on gender-based stereotypes about caregiving responsibilities. So even in corners of DOL's work that you might not think are relevant, caregiving still is. Another one of our great partners in this is our Office of Disability Employment Policy. ODEP has done an enormous amount of work in this space, but just a few recent highlights include that their EARN network released an updated toolkit for employers on workplace flexibility that has recommendations that explicitly reflect the Raise Council's work and targeted information about how to support employed caregivers. Their lead center also hosted a really phenomenal think tank and listening session on direct support professionals and shortages in that workforce. That information was shared with 18 different government agencies and compiled together into a report with highlights that I'm going to share in the chat as a link. I am at the Women's Bureau, which is the only federal agency that's mandated to represent the needs of employed women. And so we obviously care a lot about caregiving. We have done an enormous amount of work over the last couple of years in this space, but a few highlights from earlier this year, we collaborated with the Wage and Hour Division to mark the 30th anniversary of the Family and Medical Leave Act and release new research and education materials around that. New research looking at the financial costs that women experience as a result of family caregiving responsibilities. We've launched a number of data interactives looking at access to workplace leave and flexibility, as well as a brand new one on grandparents raising grandchildren. And we've launched a website about paid leave specifically that includes information about state programs and compiles a significant amount of our research and microsimulation in that space. I also just want to very quickly highlight that earlier this spring, President Biden issued the executive order on increasing access to high quality care and supporting caregivers. And so while that is not necessarily part of the national strategy directly because it happened so recently, this is also impacting our work at DOL, which includes our collaboration across federal agencies, including with HHS. And that's the aspect of my work that I am currently the most excited about, getting to work on research looking at wages for the care workforce, and also looking in deep collaboration with my friends at HHS on data issues that are related to the home and community-based service providing workforce. I also just want to quickly plug that our Employment and Training Administration is going to have grants that are coming out very soon before the end of this month, critical sectors job quality grants that also contain a focus on the care economy. So more to come on that. I will end here, and I will end here because I know we're running out of time. Thank you all so much. To Greg. Thank you all so much.
Thank you so much. Thank you so much, Sarah. And I would like to just reiterate the President Biden's care executive order. What's really amazing about it is that it calls out specifically the national strategy to support family caregivers and how it is meant to bring the federal partners to the table and to work together on behalf of family caregivers. And there's a link to it on the ACL Raise page, and we will drop that into the chat so folks can see that. Bev Yang at the Consumer Financial Protection Bureau, are you ready to give an update?
Yes, I just need to start my video. Thank you, Greg. I hope you can hear me. First of all, I'm a member of the Supporting Grandparents and Raising Grandchildren Council, and I'm in the Office for Older Americans at the CFPB. We are charged with both looking out for consumer financial unfair, deceptive, or abusive financial practices, and also working with federal and state partners to understand and address those risks to consumers. So including caregivers and older adults. So we've heard from attorneys and state ombudsmen that some debt collectors were or have been demanding payment from caregivers and suing them as well for nursing home debt. And as you know, caregivers can be relatives or other kin unrelated by blood. Caregivers may not have legal authority over their loved one's finances and may accompany that person to healthcare visits. Well, nursing homes were apparently sometimes requiring caregivers to sign admissions contracts that include a personal guarantee or promise to pay the residents' bills, and suing those caregivers personally for payment, including boilerplate language in court documents that accuse the caregivers of stealing the residents' money. And the frequency with which these boilerplate allegations appeared in court documents, regardless of the caregiver's actual access to the funds, was concerning. So these attempts by some nursing homes to hold caregivers liable for residents' debts as a condition of admission they violate the Nursing Home Reform Act, and attempts to collect from caregivers based on these contract terms may violate the Fair Debt Collection Practices Act and the Fair Credit Reporting Act, the consumer financial federal acts that we regulate and enforce. To promote awareness among members of the public, caregivers, and direct service providers, and encourage corrective action by health and financial providers, the CFPB published an issue brief, held a public field hearing with the director, with experts and caregivers, issued an enforcement circular to other enforcement agencies, and also issued a joint letter to debt collectors and nursing homes with CMS. We also published a joint blog for long-term care ombudsman with ACL, and continue to hold webinars, for instance, with state health insurance counselors and others. Thank you.
Thank you so much, Bev. We really appreciate the collaboration with the Consumer Financial Protection Bureau. And last but not least, Carmen Sanchez and the Department of Education for their report. Carmen?
Thank you, Greg. I will be brief. We have a PowerPoint that has some links for people, and I will put that into the chat in order to have people follow up on some of these activities after this meeting. In general, our role in the Department of Education is really to partner with ACL and HHS in order to amplify all the messages that you're providing to get our populations aware of your all these activities. We usually have most of the work around caregiving is in the office I'm located in, which is the Office of Special Education Programs, since they're often parents of children with special education or special health care needs. And we fund a series of centers that are meant to educate those family caregivers about their children. So having this kind of information that you all are providing from the different agencies available so they can amplify the messages and we can amplify the messages is just really important. We also have within our Department of Ed, we have various newsletters that take out the message about what's going on throughout the federal government, such as the Early Learning Newsletter. And our Office of Communication and Outreach also does a really good job of amplifying messages so that families and grandparents who are raising children who get education can find out what's available to them and how they can be supported. We also have a very active social media presence, and we have the Buzz from the Hub, which is what one of our centers also does to amplify the message, and that goes out to not only all the parent training information centers and other centers that we support throughout the country, but it also goes out to direct consumers. In addition, we have statewide family engagement centers, and they, again, are concerned with helping family members educate their children in general education in all aspects of life, not just special education. And one of them, and again, I have links to that, is the Ohio Family Engagement Center that has specific materials that are just for grand families and kinship, kin care families. It's a long day, so that they can get some additional support there, and it refers back directly to the work of this council. I mentioned our National Center for Parents of Children with special health care and special education needs. That's the Center for Parent Information and Resources. And you can look there and see all the kinds of ways in which they amplify the message. In addition to the parent training information centers we have throughout the country, we also have some community parent resource centers, and one of them in Virginia especially is concerned with kinship families, and that's Formed Families Forward. And we really do a good job of advertising their resources to the other parent centers and to advertise their resources nationally to families directly. So those are just some of the ways in which we amplify the message that you all have. We did do some work, and I can do that in a later report because it dates back to May and not March, around some of the behavioral needs of children with children with disabilities that can also be applicable and supportive of family caregivers more generally. But I can report on that and also send out a link separately. So that's basically the highlights. And like I said, I'm happy to put a link to the PowerPoint with all those links in directly into the chat. Thank you very much.
Thank you so much, Carmen, and thank you to all of our federal partners. I know that for the council members, this is certainly a ton of information. We won't be giving a test on it this afternoon, but maybe tomorrow. I'm just kidding. No, we really felt that in the year that's passed since the strategy has been released, we felt it was absolutely critical that you all hear the progress and the work that's been going on, because this will help frame the discussions that you all are going to have with amongst yourselves as to where the strategy needs to go next. And so we felt it was absolutely critical to get this information out there. We will be putting together a report, sort of an interim progress report on the how the federal agencies have been doing and what they've been doing in terms of all of the actions. So the report outs that you heard today will form some of the narrative to that report. And we will also be looking at the specific actions that were in the strategy with progress updates. That report's going to take some time to pull together. We probably won't have it ready in the next few weeks, but it will take some time, but it will be coming. So if we can go to the next slide, we want to, in the time we have left, council members, we wanted to engage in a bit more discussion with you about where we need to move next in your work. Can we go to the next slide, please? Next slide.
Yes, one moment, please.
As we're moving to the next slide, I just wanted to open it to the council members for any initial reactions or thoughts on the report outs that you heard from the federal agencies. As we're waiting for the next slide to come up, feel free to raise your hand and I will call on you. Okay, so Cheryl, go ahead.
Hi, thank you. I would just like to thank them for all of the information that they provided to us today. I really appreciate it, and as well as all the links that have been provided. So thank you.
Great, thank you. Neil.
I would want to just point out, reiterate, and underscore that what Dr. Jolie Crowder was talking about from Indian Health Service and the increased interest, increased funding for dealing with a variety of aging issues with Indian Health Service is a relatively new sort of boost to what had been there for some time. And that boost has really come along at the right time. So I think that is something for us to pay attention to and be grateful for.
Thank you. Jonathan.
Just wanted to again say thank you to everybody that was presenting. I, up to this council, had thought of a few federal agencies that I was really focused on. I didn't realize the breadth and depth of all of the agencies and what they're doing. So I really appreciated the breadth of all the agencies and a little bit of insight as to what they've been doing. This has been great.
Excellent. Gloria.
Yes, I too want to thank all the agencies that reported. I think the realization of what they're doing is it's great. And I think that it's good to see that they are working on it already. And we appreciate all their information. I wish I could get a copy of all the chat information. I'm sure you'll send it to us, but they were just outstanding. So I want to thank them all.
Great. Carol?
Yeah, I just want to say how amazing it is to think that a year ago we put out a document and had all of these calls to action. And here you had all of the federal partners coming back and saying, this is what we did. This is what's in progress. I mean, it really is amazing work that has happened in the last year. And I know there's more to come. Thank you.
Thanks. And Keith.
Just amazing to me, the value and information that was given to us today and the breadth of everybody that participated. It was just so much information. It was great. And I appreciate just all the agencies coming together. That was really, really nice.
And we're going to continue to do that. That's been, I think, one of the things that has made this work for me personally and professionally, and I think Lori would echo that, is the engagement that we've had with our federal colleagues around this issue is so incredibly strong. And it's the commitment that we're seeing, and this is just the start. One of the things that you all as councils begin to work both together like you are today, but you are going to be meeting separately as your own individual councils to begin to think through what the national strategy looks at next. Where does it move? How do we grow it? How do we expand it? We need to know from you the types of information. Where do you think you need to hear additional presentations? A lot of the meetings that we do like this moving forward will be about having entities, subject matter experts, issue areas presented to you for consideration. And so I'd like, and this really goes out, is going to be used by NASHP and our TA Center colleagues to really begin to shape what future meetings look like. But I would love to hear from the council members answers to any of these three questions, because that will begin to shape how we support you and your work moving forward. So I open the floor for discussion around these three questions. And if you raise your hand, I'll call on you. You can also drop it in the chat that's visible, and all of that information is captured. But we do like to know sort of where do you feel presentations and information gathering for your work needs to move next. Carol.
I did that kind of backwards. I don't know if it's Generations United, but in thinking about the synergy of putting together everyone that has common interest. Where we have not done well in aging is where we have not worked with other age groups. So the disabilities community, the children's groups, the aging groups. When you look at the strategy, how do we tease out those things that are very clearly cross-generational, where we can get a louder megaphone? And I don't know, we're not good at it in aging. I would love to hear from some people who have done more work across generations.
Okay, great. And I know that that's one of the focus areas that's high on our administrator, Allison Barkoff. And so I know that she will be really looking to bring in presentations that really seek to work across these cross-population, cross-age group issues, cross aging and disability as well. So thank you. Neil.
I think going forward, there is a need to recognize that different cultural groups across the country here have different perspectives, different beliefs, values about aging, about caregiving, about dementia, and the behaviors that go along with dementia that we need to take account for, because otherwise we may come up with the mistake that often happens of a one size fits all.
Mm-hmm.
And so I think there is a body of literature about this already, and yet converting that into action, into policy, I think is something that remains to be done. And then again, associated with that to some degree is helping to understand caregiving along lines of economic disparity and health disparities. And I think those are factors that increase, again, the variation on a theme across caregiving of all kinds.
Okay, so what I'm hearing is maybe some synthesization of research and or literature reviews that would help inform the council's work and decision making, at least partly.
Well, I think that would be a starting place. Yes.
Okay. All right.
Sort of a meta-analysis.
Okay.
Of, what we have out there.
Great. Thank you. Gloria.
Yes, I'd like to just say that I know that there are many states out there who are working on their own, if you will, strategy for our caregivers. Like the state of California, we have the Master Plan on Aging. I'd like to see if we can get some information from there for review and see how closely they're tied into our strategy, to see that we're all working together to get that done, and that we partner with them and see if we can help each other and see what works for them, what isn't working for them, and what we can change and what we can add to our strategy. Thank
Great.
you.
Thank you. Lynn.
Yes, thank you. I love that comment that was just made. Because I've been thinking about, I guess, the work of this council. When you ask me what I need to hear, I'm not quite sure, because I'm still a little bit fuzzy on what my next task is on the council. So that's, but I have talked to Missouri and a couple other states that are doing things like you're just mentioning. And when I think about what our priorities are going to be for at the state level or individually, you know, and I've been looking at these different conferences. I just went to the HCBS conference, and it was great having everybody together and hearing all that information, sharing that. And I think about some of the other conferences coming up, like Aging in America conference, and got the lifespan respite, you know, other things that are coming up. And I wonder, is there going to be a discussion, or is there a way for our council or council members to somehow get information out of the people who are attending those about what's working, what isn't, what we might want to prioritize? I don't know. It's just something I've kind of been.
So using those conferences as information gathering opportunities for the council?
There could be one way, about what's kind of what's happening on the ground. I know we like to think we know, but sometimes you talk to people and you find out, wow, that was going on.
Okay.
You know, even though, just something to think about. I'm not sure.
No, absolutely. That makes perfect sense. And we are shortly, right? Absolutely. Next, we're going to be, Lori and I are going to talk to the council members a little bit about how do we begin to work moving forward. We're going to need to talk about breaking into subcommittees, working subcommittees that will meet on a regular cadence, not in public forums, but to really dig into some of these issues, looking at the strategy, pulling it apart, seeing where it needs to grow and shape, and then the types of information and support you need to do that. So we're going to get to that in just a moment. Jesse.
Hi, we were speaking on, there was a couple comments ago, speaking of how we need to reach out to the younger disabled and people in states that have working home health programs, like in California. I just want to say I am a 37-year-old quadriplegic, paralyzed from the neck down, who does live in California using these services. So when we do split out subcommittees, I would love to be on a committee that could give about my resources and my knowledge about that, because I have a lot of experience with using these services and what they do really well and what they could do better.
And that is why you are on the council. So we appreciate you and we'll be reaching back to you. Jennifer Wolf.
Oh, thanks. I am, I guess, just reflecting on, it was a lot of information today from the federal stakeholders, and it's very exciting to hear about the progress that's been made. I am very excited about the specific recommendations, and I think there's a lot to be gained from looking across the goals. We know a lot about the caregiver stress process and the caregiving experience, but a lot of the interventional work has been done in convenience samples. And I think trying to sort of hear about both work that can be led by federal stakeholders, but also from care delivery providers, care delivery organizations, that if it was done well, if these recommendations are implemented, would really reach caregivers, to me seems very important, because we would then be developing recommendations that could be used for scaling these interventions and getting them out in mainstream care. So I guess I'm very encouraged to hear about the possibility of working in smaller subgroups on next steps, and just thinking about how to organize ourselves to do that.
Great. And so what I'm hearing from you, Jennifer, is probably what you're really interested in is hearing about best practices, promising practices that may be very localized, but show promise for replication and expansion and translation elsewhere.
And work that could be, that would be more or less executed by care delivery providers. A lot of that work by health plans, for example, Medicare Advantage plans, is not visible, but because they are, proprietary care delivery organizations, but the federal stakeholder and the synergies across the federal stakeholders really could both stimulate progress, but also transparency, so that we can really better understand what best practices are and promote those best practices more broadly.
Okay, great. I will probably follow up with you a little bit more and pick your brain a little bit more on exactly that and how we can accomplish that. Final comment, and then we're going to move into the last part of our discussion. Dr. Crowder.
Obviously, Jennifer and I have a Jedi mind connection, so totally support what she said. I think it might be helpful because the group did their foundational research work, a year or two ago, then the recommendations. So what might be helpful for me is sort of a state of the science on caregiving in general, and then a state of the science on caregiving interventions. And that could get at Jennifer's suggestion about understanding care delivery systems and the like, although maybe science is too formal. And so it's like, what is the leading and emergent work being done in this space, like in the last year or two? And then very specifically, I think, and because I'm selfish, this work of identifying and tracking caregivers in electronic health records, which I think actually could extend beyond clinical settings into community settings. Like, what is the tool and how are we doing it in a systematic way? And to see, perhaps hear from some health systems who are leading the way, or community-based systems that are linking with clinical systems in that space. Really big gap for us, I think. Really big gap for us, I think. Thank you so much.
Great,
Thank you so much.
Great. Okay. This has been great. This has been great. I'm very mindful of the time we only have. So what we need to do is turn to a discussion of how you all want to work moving forward. And we're thinking perhaps subcommittee structure. So Lori, did you want to sort of kick off our discussion and get some thinking going around discussion and get some thinking going around working subcommittees?
Would love to. So we have two councils, but we have some cross-cutting themes. And we're not saying subcommittees we want to look at the individual subcommittees, but it may be a possibility for something like respite where it can go across different subcommittees. We're not required to, so I don't want anybody to panic, but thinking about the things we've heard today, thinking about the things we might want more information about. We generally, subcommittees or working groups are generally, a subset. We don't meet in full council. It's a topic that you in your orientation guides, topics of interest. And as we think about all the information that's come in today and all the ideas people have given out, what might be some ways to form, what might be some topical titles for subcommittees for people to join in on? And I'm speaking to both councils, so the Raise Council and the Grandparent Council, collectively and individually. So, just brainstorm ideas and just identify which council you're from, so we can sort of see if there's overlap or if it's all distinctly different. Yes, Jody.
Well, I don't know if this is exactly what you're asking for.
I can't hear you.
Okay.
I can hear you now.
Oh, okay. I don't know whether this is exactly what you're asking for. But I think one of the things that struck me a little bit earlier was when we were talking about like things that were missing, or things, that really could help people, and how we tackle those. I mean, a lot of the things that we do are information sharing and idea sharing and collaboratives and these kinds of things. But when you're really a person in crisis and becoming a caregiver when you don't know you're going to be one, which I think someone said something about earlier, which is absolutely true. Is there something that we can act on that's within, the goals that are set already, or a new one? And this is just something to think about, because I know the work that it would take. I don't know, but I can only imagine, which is scary, the work that it would take to get it done and to maintain it. But really looking at the landscape of what information is publicly available that kind of gets everything, not everything, but gets resources together in one place that could be maintained. I know that's again a challenge because it takes money and time and dedication and research, but is it something that we could talk about in a subcommittee to think about? Is there a model? Is there something that could be built? And I don't know how to say the word that I want to say, but built and maintained, I guess, that really lists resources for people, hands-on resources when something happens, so that they can find help and supports and information in a digestible way when these things happen.
So you're talking about that at the time of entry into caregiving, but then there's, but just in general, thanks, Bev. Well, I think that kind of goes into the meta-analysis and what's the state of the science on caregivers and caregiver interventions. I mean, what's out there and what could we, in our subcommittees, look at, learn more about, perhaps in presentations, which helps to educate not only ourselves, but the public who attend, the people who attend from the public, about where we can drive the strategy, because we can't do everything all at once, but until we know what we don't know, we can't decide which one of these, like, where's the gap? What's missing? Where, maybe we can't in 3 years compile everything that's out there, but
Well, and
what's,
it's going to change in a year after that. I mean, but
yeah.
really just starting to think about like what concrete thing that could live on a website, that maybe could be maintained by somebody, that really kind of gathered all of that together, or at least resources like here's a state map. And if you click on Nevada, here's what Nevada has.
Oh.
So it could be, it's huge, right?
You're
So
going big.
Well, I'm not promising anything. I just want to, it's something to brainstorm, I guess, is what I'm saying. Not that we are gonna, but.
And anyone else feel free to hop on camera and join the discussion, but it's a long range goal. It's sort of like changing is there a change to recommendations? Is there a cross section now of the, it kind of bleeds into everything we were talking about, but
absolutely.
But if this becomes a long range goal of this council and a way to adjust or revamp some of the strategy, then how do we move forward through the use of our subcommittees to make that happen? Yes, Daniel.
Thank you so much. It's this. I love this dialogue specifically. It's a problem I've been solving for myself for the better part of the last several years. National Council on Aging does have an excellent tool called a benefit checkup. It's benefitcheckup.org. A good tool for it's similar. Sorry, I didn't catch who spoke, but it's a tool similar to what was introduced. It is limited. It's tough to get personalized recommendations from that tool, but there's nothing that comes anywhere close to it.
Alzheimer's
as a public
Association.
resource.
Even just a list of those tools. I mean, when you're in those situations, it took you how many years to hear about it? You know what I mean? Like if there's even a list, like that kind of thing is what I'm talking about. Just something.
But so how does that translate into work ahead, John? Subcommittees work ahead for both councils, Jonathan?
So I agree with all of that in terms of what the current state of the world is and where those resources are. I'm interested in a subcommittee and would love to find others that we're interested in the forward thinking. We have a provider shortage. We have a nursing shortage. How do we help? What are the tools or things that we can be doing to address reimbursement rates, licensing regulations that are going to get us more providers? Because at the end of the day, there's wait lists. There's just nobody to provide the care out there. And that's the part that I really am passionate to want to challenge. I'm on the kid side, but I know the same issue also exists on the elder side with dementia and elder care as well.
Keith.
I think Jody's, you got to start somewhere in this, and there's no reason not to start it here and let somebody else finish it down the road, or improve it, or even update it, whenever it needs updating. But I think you got to start somewhere, and I think that's a wonderful idea.
So I think it's a broader discussion. Yes, Carol. Yes, Carol Cox. You're on mute. There we go.
Yeah, what I was saying before, which I feel very, very passionate about, is that we all know that caregivers are often isolated. They are stressed. To even get to a support group, to get to a senior center is difficult. I think that the idea that I had used during COVID with online support groups for grandparent caregivers was really well received. And there's no reason, since COVID ended, we know that there are still caregivers, grandparent caregivers, family caregivers, certainly dementia caregivers, who have a difficult time getting out, just cannot leave the person. And having the access to a remote program that they can get to, where they can meet other caregivers in exactly the same situation. I was stunned how they developed relationships just on Zoom and called each other and talked to each other. It fills a gap, and I would really like to see something about that. That's it.
Oh, I think I understand, the virtual support groups, but I think going back to our meeting in July, also talking about the use of technology to better connect services and caregivers. Support group, be it a virtual support group, be it a national benefits checkup kind of website. I live in the state of Maryland. They've just recently developed a portal for us to use. It's got some quirks, but it's a good effort for renewing like SNAP child support and food assistance and that sort of thing. So the technology aspect.
Technology, everybody's into tech. I mean,
Well, and caregivers are isolated and sometimes getting out, but also care recipients can be isolated too.
Exactly.
And they can work for both sides of the equation. Yes, Daniel.
Oh, in any subcommittee associated with solving that, sign me up.
I thought I
It's close.
recalled you and Jonathan, I think were our.
Yeah.
So what would we call that subcommittee? What would
man.
its short, sweet topic name?
Benefit navigation is what I have referred to this topic for years. I don't know if that's the appropriate heading for recognizing the focus of our committees, but that's how I've always couched the.
Okay, what was it, and what did you say it was?
Benefit navigation.
Okay.
I think about a capacity building, access.
That sounds way better than benefit navigation. Yeah, I like that.
Okay.
Which, if we're talking about support groups as well as benefits, thinking Medicare, Medicaid, food stamps, SSI, we might broaden the title. Everyone, please feel free to join in. Nancy, yes. You're on screen, but your hand's not up, but I'm going to call on you.
It's okay. I had it up and then I just wrote my comment in the chat box instead. I think the thing is that there's so many intersections of all of our realms, if you will, for lack of a better word. And where are those common grounds? And it may be respite, resource access, etc. There may be technology, certainly would be one. I still think there's a little bit of a unique experience as a lifelong caregiver of a person with disabilities that might set that group a little bit aside. And there's even resistance. And I'm sure you know this first realm of developing the councils. There's even resistance within the disability community to refer to people like me as a caregiver because it may diminish the ability of that person. I don't get hung up on that word, but I've heard it from other realms. So I don't even know
Very aware
exactly
of
where I'm
that.
going, but I do think there's so many intersections. Yeah.
And Liliana suggested benefit and navigation, access and support. And Greg said he thinks we need to wrap up. And people are leaving.
We do need to wrap up.
Well, I don't know why you put me on at the end. I can stay here all day. Come on, people, talk to me.
Because our captioner has to leave.
So
as
sorry, Joanne.
As always, this has been an unbelievable conversation. Council members, what Lori and I are going to do is follow up with you to continue the discussion in an email about subcommittee structures and topic areas, and we'll send you some questions about where you want to divide up along working topics, things of that nature. That will be one thing. The other area that we're going to probe with you is a meeting cadence. Both the RAISE Act requires that the Family Caregiving Advisory Council meet 3 times a year. So when does that occur? It would be ideal to be able to have regular or predictable, every 4 months on a certain day, so that you all can plan your schedules around that. So we will be reaching back to you all via email. For the members of the public who are still tuned in, a recording of this meeting, the PowerPoint slides, everything will be posted on our website. Within the next week or two, we have to make sure that we have the transcripts 508 compliant and accessible, and that they sync up with the videos. But with that, if there are no other last minute questions or comments, we will adjourn for today with a huge, Lori.
I want to apologize to anyone who had their hands up that I didn't notice because I didn't know it worked on the
That's
panel
okay.
screen.
No
Felicia
worries.
Lynn, apologies.
Okay, so with that, we will adjourn for today, and we will be in touch very, very soon with some follow-up questions and work with you. To our co-chairs, Lori and I will also be in touch with you about circling around to figure out how we best leverage your experience, your expertise, and your willingness to serve in the co-chair role. So all of that to come. For now, thank you all so much, and we look forward to the next time.
Wonderful meeting as always.
Bye,
Thank you.
everyone.
Thank you.
Bye, everyone.
Take care.
Bye-bye.
Bye.
Bye, thanks, everyone. Good meeting.
Good.
Thank you,
Glad.
everyone. Great
Good job,
meeting.
Lori and Greg.
You guys all take
Great.
care.
That was a great meeting with great information. Thank you so much.
Oh, it's great to have you here, Jesse. Can't wait to meet with you in our smaller settings. Thank you, Felicia. Oh, why am I don't want to just see me. Where'd everybody go? Oh,
Hi, Lori.
Hi, Lori.
hi, Cheryl. Hi, Chantal.
I went ahead and removed your spotlight.
Hello, Chloe. I don't know. I gotta close all this stuff. Where are you? I'm in gallery. Why can't I? Oh, you're not there. That's why. Oh, I'd put, no wonder I didn't see the hands up. I'd put hide non-video participants.
Hello.
I got my moment. How'd I do?
Wonderful. Wonderful.
Great.
Chantal, I'm going to stop the recording.
Okay.
Yes.